Ladies and gentlemen, if we'll get seated, we'll get started. Good morning. We're glad to see everybody. We got a good crowd this morning. Might be a little money wrapped up in this budget talks this morning. Mr. Chairman, anything you want to share with the group?
Good to go.
Good to go. All right, great. Mr. Clyde Reese, formerly of DCH, now of DHS. Good to see you.
Good morning. Thank you, Mr. Chair, members of the committee, other honored members of the General Assembly. I'm pleased to be here, privileged to be here this morning before you as Commissioner of the Department of Human Services. This is my, due to the snow and ice of last week, this is my first full week at the helm. So I'm happy to be there. We've got some DHS staff here to assist me and who helped me in putting together this presentation. Mr. Mark Norwood is the budget director, is here with me up front. Mr. Lynn Berlinga, our chief financial officer, here to my left, and in the back we have numerous program directors for the various areas of the department who can help me with questions that you might have that I'm not able to answer. Let's get right into it. This is the Governor's recommendations for the fiscal year 11 amended and fiscal year 12 budgets for the Department of Human Services. As you recall, in the 2009 reorganization of the healthcare agencies, the General Assembly moved some things around. So the Department of Human Services is composed now primarily the Department of Family and Children's Services, as known as DFACS, the Division of Aging, Division of Child Support Services, and Residential Child Care. You're all very aware the last 3 years agencies have taken a lot of budget cuts as a result of the fiscal situation in the country and the state in particular. And so most agencies, including Department of Human Services, we are down now to bone. There's no more fat left. There hasn't been any for quite a while. We're down to, as I think you heard last year from the department and you're going to hear again today, we're down to the things that the department must do. So that's really the theme of what our presentation is. What are the must-dos for the Department of Human Services and what budget items are related to that? So you'll hear me talk about services that we're required to deliver or provide pursuant to state or federal statute, pursuant to rule, regulation, or some other requirement, grant or contractual obligations that extend through fiscal year 12 at a minimum, and consent decree requirements. That's primarily the Kenny A consent decree with regard to foster care services in Fulton and DeKalb counties that you may be familiar with. So I'll talk a little bit about that as we go along. So DHS, our frontline workers, perform the must-do services. So I wanted to, before we get into the actual numbers, budget numbers, I wanted to talk about, for all the different programs and all the different areas of the department, what are the must-dos that go along with those requirements that I just listed. So let's start with Child Welfare Services, the Division of Family and Children's Services. With regard to safety, this area must respond timely to 95% of reports of alleged abuse and neglect. Current response time is 96.8%. Must complete 95% of investigations within 30 business days. Currently, the rate is 98.3%. Maintain a recurrence of substantiated child maltreatment below the national standard of 5.4%. Currently, it's at 2.1%. Reduce substantiated maltreatment in care from 0.84% to 0.32% or below. This is the national standard. With regard to permanency of placement of children, maintain foster care reentry rates at or below the national standard of 8.6%. The current reentry rate is 3.3%. Well-being, per federal mandate, conduct a face-to-face visit with 95% of all children in our foster care services every month. Current visitation rate is 98.7%. With regard to federal mandates and the consent decree, there is a Child Family Services review conducted by the federal government. A review of the department was conducted. There were findings. The department is under a program improvement plan, and we must meet those goals outlined in that plan by June 30 of this year or face an $8.8 million penalty. And we must meet the performance mandates of the Kenny A consent decree, of which there are approximately, I think, 31 benchmarks that the department is held to. And if you have specific questions about that later, we have people who can talk to that more specifically. I wanted to show you a graph of the progression of some of the services. This first one is child welfare, the ratio of cases per case manager. We look at starting with fiscal year 2004, we were at 21 cases per manager. Now in fiscal year 10, we're at 15, which is the national standard. Let's look at eligibility must-dos. With regard to food stamps, we must process 95% of applications in a timely manner, timely being 30 days. Currently, we are at 87%, so we're in a corrective action plan to get to that standard. Maintain error rate below federal standard of 5%. Currently, we are 1.95%. Caseload growth for food stamps between December 2009 and December 2010, that 12-month period, is 110,477 cases. That's a 17.8% increase. We also contract with the Department of Community Health to do Medicaid eligibility. It processed 96% of applications in a timely manner. Currently, we are at 97.4%. The caseload growth for Medicaid is 15,769, or 2.2% in that 12-month period. With regard to temporary assistance for needy families, or TANF, we must process 95% of applications in a timely manner. Currently, we're at 95.2. And we must meet the 50% TANF work participation rate. We're at 71% now. Let's look at the ratio of cases per eligibility worker. You can see in 2004, we're at 379. Now we're all the way up to 667. So the case loads for the workers have increased exponentially. With regard with demand for eligibility services, that also has increased. You look at 2004, a little under 1 million. Now we're at almost 1.5 million, 48% increase. And you'll see a reference there to Hurricane Katrina, which created a blip and has contributed somewhat to the rise even today. Excuse me. Let's go next to the Division of Aging Services. Aging must, let's start with Adult Protective Services, must contact new referrals within 10 days, must conduct investigations within 30 days. With regard to guardianship, provides case management for more than 660 adult wards of the state. For the Community Care Service Program, which is a Medicaid waiver program, delay nursing home admissions by 45 months or more, that's the goal. And for the non-Medicaid home and community-based services, delay nursing home admissions by 30 months or more. And the long-term care ombudsman program, resolve complaints satisfactorily 95% of the time. This next slide is just to show you the rise in the unduplicated cases in adult protective services. You'll see that for projected for fiscal year 11, the unduplicated cases were right at or above 12,000. And by unduplicated, we mean these are distinct individuals. And you can see the bar graph going across. These are the number of cases per worker, per staff worker. Let's move now to Division of Child Support Services. Child support must register an application within 20 days of receipt. Same-day service applications are registered the same day of receipt. Locate a non-custodial parent within 75 days of receiving an application. Establish financial and/or medical order within 90 days of locating the non-custodial parent. Establish paternity of 90% or better, rate of 90% or better. Failure to meet this results in penalties with regard to the TANF block grant. Must enforce court orders within 30 days of delinquency. Collect and forward support payments within 2 business days of receipt. And there are mandatory reviews for modification that must be initiated by child support every 3 years on all TANF cases. Next, let's talk about residential child care for a minute. Residential child care must review and issue or deny licenses for application or relicensure. Conduct investigations of incidents, complaints in licensed and unlicensed facilities. There are nearly 300 licensed facilities representing nearly 4,000 children. There are really 5 types of child caring facilities. The majority of them are child caring institutions. Then there are child placing agencies. There are outdoor child caring programs. There are maternity homes, and there is one child transitional care center in the state. This area must initiate and facilitate all enforcement actions and sanctions, establish, update, revise rules and regulations in accordance with Georgia law, and also support the mandates of the Kenya consent decree. This next graph will show you the rise in incident and complaints in this area, and also the rise in enforcement actions. We're right around 4,000 for fiscal year 10 incidents and complaints, which resulted in around a little less than 90 actually official enforcement actions. I want to talk a minute about how have we tried to address the proposed reductions. As you all know, Governor Perdue, at the end of his administration, asked the agencies to submit budgets with percentage cuts for fiscal year 11 amended of 4%, 6%, and 8%. And for fiscal year 12 to submit budgets with cuts of 6%, 8%, and 10%. So the Department of Human Services put as its top priority people who need our services and the children in our care. We had previously approached budget reduction plans with a strategy of protecting the frontline employees, the DFACS workers particularly, who are out there in the offices across the state, and limiting cuts that placed meeting MOE or maintenance of effort at risk. I'm going to talk more specifically about maintenance of effort and the importance of that to the department, but that has been one of the rationales or the goals in looking at proposed budget cuts, protecting that. After consecutive years of reducing the budget, the priority must work, and priority is the must work things. The things that we'd like to do, or the things that some people feel the department should do, those of course have had to take a back seat. So we are now, as I said, into bone. So we're at the point now where cuts could considerably place maintenance of effort at risk, affect the delivery of services, or impact frontline staffing of employees. We're appreciative of the governor and OPB in their recommendations of keeping the department at the 4% cut level, of understanding and recognizing the importance of maintenance of effort. We're also very appreciative of, as you'll see as when we get into the numbers, as you recall in the federal stimulus package, or ARA, there was money given to agencies, and the state used that in different ways. That money has gone away, but OPB and the governor have worked with us to restore some of those cuts to help us fill in budget holes. Some funding issues impacting 2011 amended and fiscal year 12. The state funding required for the TANF maintenance of effort was at the minimum level before the 4% cut. Maintenance of effort is relying on external sources to a great degree now, 28%, and the fundamental budget structure of the department is threatened by this over-reliance on the TANF block grant monies. The TANF program funding has been maximized wherever possible to the point where now there are no more reserves. With regard to residential child care, the entire state budget has been eliminated in 4% cuts. So you'll see me talk about it's entirely federal money now. Support for needy families, work assistance, the entire state dollars have been eliminated in the 4%. The child welfare services, our budget is disproportionately to the tune of 32% supported by TANF dollars. With regard to aging maintenance of effort, the minimum state level that they are required to maintain for that is $19.9 million, and we're right there at that. Child support, the minimum state participation dollar level is $19.9 million. They're very near that. Additional cuts of state funds would create deficits and put long-term funding of child support at risk. So we're in somewhat dangerous waters as we head forward with regard to money. Now I want to talk a little bit specifically about TANF. temporary assistance for needy families, block grant. The total from the federal government is $368 million. The state's requirement for maintenance of effort is $173.3 million. So you see here the various sources of maintenance of effort in the state to get to the total state appropriation of around $125 million. The department gets around $48 million from external sources, so that brings the total to that $173 that's required for maintenance of effort. When you put in the 4% budget cuts for 11 and 12, there is a deficit in the maintenance of effort required for the state and for the department of around $13.9 million. What the department has done is go out to private entities to make in-kind contributions which are matched either $1 to 3 or $1 to 6 to help make up that deficit in the maintenance of effort. And we have contracts in place that we think will fill that hole. The way the maintenance of effort works is when you have a deficit and the state does not maintain its share, then the grant goes down on a dollar-for-dollar basis. And at the same time, the state requirement goes up on a dollar-for-dollar basis. So if, for example, with the 4% reduction, if we did not find maintenance of effort dollars in other places, that 13.9 deficit would drop the amount of the block grant, and then the state participation amount would go up 13.9%. So it's a 13.9 million. So it's a double whammy, as it were. So it's very important, and we urge you to please be cognizant of that. With regard to the Older Americans Act, this is within the aging area. The 4% budget reduction takes aging down to that maintenance of effort level. At $19.9 million, the current MOE in the budget for 11 is 21.5. The governor's recommendation is the 19.9. That leaves a difference of $5,941, which we feel we can manage that. With regard to child support, minimum state funds participation, the proposed 4% reductions do not impact maintenance of effort. There's a minimum state participation rate of $19.9 million. The MOE from the governor's recommendation is 21.6. So the governor's restoration of the lost R funding eliminates the risk in this particular category. So this is one of the many ways in which that restoration of R funding has helped the department. The guiding principles of the governor's recommendation for fiscal year 11 amended and also for fiscal year 12 are to protect the mandated service levels and the frontline staff delivering must-do services. I want to consider and understand the importance of maintenance of effort as I've described. We want to strategically manage the attrition of staff throughout the department and to streamline operations and to manage impact to service delivery. Let's start getting into some of the numbers of the recommendations that are in the governor's budget document. We'll start with fiscal year 11 amended. And as I go through the different programs initially, I will give you just a summary of what that particular program is, and I won't repeat it for fiscal year 12. But adoption services, the dollars in this category, are to support and facilitate the safe, permanent placement of children by pre-screening families and providing support and financial services after adoption. One thing I'd like to mention, you'll see it's repeated on each one of these slides for 11 amended and 12. And I'll go through it initially here and not on each slide for each program. But you'll see first current budget and state funds. Then you'll see an item called statewide reductions. What that is an expense that OPB has calculated for the books. This is not actually, when you see it reflected as a positive, it is not actual dollars added to our budget, but it is an expense reflected on the books by OPB, and it is adjustment related to workers' comp expenses throughout the state. It is adjustment related to telecommunication expenses. Now for fiscal year 12, not for 11, there is also an adjustment related to the employee's retirement system. So when you see this item, statewide reduction, those are the three things that it refers to, and that's what this is about. Here you'll see for adoption services, we have a replacement of the loss of the enhanced Title 4E ARA funds. We have all other reductions, and you'll see consistently on these slides what we are including in the category of all other reductions. You'll see one for each program where the department has taken funds that were in the administration program budget for unemployment insurance and moved those to the different program areas. So you'll see that reflected in each one of these slides. Here we've also reduced contracts by 4%. One of these is a Family's First contract. The other is a Morningstar contract. So you'll see ultimately here, the governor's recommendation for adoption services is at $32.3 million. We move to child care licensing. These dollars protect the health and safety of children who receive full-time care outside of the home by licensing, monitoring, and inspecting residential care providers. Current state budget, $343,200. What we've done is totally eliminated the state dollars here and replaced with federal TANF funds. So the line item for state budget for fiscal year 11 for this category is 0. Move to child support services. These dollars encourage and enforce the parental responsibility of paying financial support. We have for current budget state funds for 11, a little over $20 million. You'll see the amount for reductions. You'll see here we've gotten a replacement of the lost ARA funds reflected. You've got your other reductions. The department offered up $1 million in this area for telecommunications expenses with GTA. And we have that unemployment insurance adjustment that you'll see in all of these programs. And so the net here for fiscal year 2011 amended, the governor's recommendation comes out to $21.6 million. Next, child welfare services. These dollars help investigate allegations of child abuse, abandonment, and neglect, and provide services to protect the child and strengthen the family. We have here current budget 89.4. You've got your statewide reductions, your other reductions. The contractual reductions here are the Accenture Shines contract. We have $57,000 we cut for that contract, and a contract with the Department of Technical Adult Education for education and training. We cut some $54,000 from a contract for that. So your net here is you have a reduction, slight reduction in this category for the governor's recommendation to $89.2 million. Now we go to department administration. I want to make a comment about the department's administration budget. You'll see this figure here of $37 million and a little more. Let me make clear that this seems like a high number, but what I've come to understand and learn is that this number includes more things than just what you might consider for the administration of a department. This is not just, for whatever reason, this has been done, and it's something we'll look at. This item includes not only personnel costs, operational expenses, but it also includes such things as transportation services for clients to the tune of $520,000. These are state budget figures that I'm citing. Mailing for the Success Program, this automated program for eligibility services. There's a figure of $845,000 in this $37 million that relates to food stamp caseloads. EBT processing fees, electronic benefit transfers, that's related to the food stamp program. There's $1.6 million in for this. Facility rentals, there's $4.2 million here. And food stamp fraud investigation, there's $1.4 million here. So almost or more than 20% of this administration figure is for things other than what you might normally consider or think about for administrative services. So I say that so you'll have that in mind, and as I said, that's something that I have been made aware of this week. You'll see ultimately here there's been a reduction. If you'll recall, In the reorganization of healthcare agencies in 2009, the Division of Public Health was removed from the old Department of Human Resources and put into the Department of Community Health. The Office of Regulatory Services, or the licensure arm for the state, was moved from DHR in a two-step process, but finalized in 2009, moved to DCH. So you'll see an amount here reflected for expenses to go to DCH and also to the Mental Health Department, Department of Behavioral Health, Developmental Disabilities, of a little over $3 million to reflect telecommunication and software licensing costs. So that's one of the reductions in administration budget here. Ultimately, you come down to an amended figure for 11 of $33.7 million. Next, we go to elder abuse investigation and prevention. These dollars prevent disabled adults and elder persons from abuse, exploitation, and neglect, investigate situations where those things may have occurred. We have state funds of $11.7 million. We have the statewide reductions. We have the unemployment insurance adjustment, and the ultimate figure here for fiscal year 11 amended is $11.6 million. Next, we go to elderly community living services. These are the services, both CCSP and also non-Medicaid home and community-based services are included primarily in this category to help seniors be able to, who may be at a nursing home level of care, receive services in their communities rather than going into a long-term care facility. We have $60.8 million in current state budget. You see your replacement of the lost ARROW funds. You'll see the reference here to enhanced FMAP. You're familiar with the adjustment that was made by the federal government stimulus to increase the Medicaid participation rate. That was extended. You remember last year there was a concern about there being a hole in the budget if that FMAP extension did not go into effect. It was extended for the additional 6 months, but at a lower figure than originally. So we have dollars here to reflect that loss, and as I said, they were put back for us, and we're appreciative of that. We also have some contractual cuts here in this area. We have eliminated a Center for Visually Impaired contract. We've eliminated an Alzheimer's respite services contract, and you'll see the redistribution of unemployment funds. So ultimately here, we have a slight reduction in this category down to $60.4 million. We move to elder support services. These dollars assist older Georgians so they may live in their homes and communities by providing health, employment, nutrition, and other support and education services. Current state budget, $665,000. The categories that we've gone over with a net here, $666,755. Next, we talk about family violence services. These dollars provide safe shelter and related services for victims of family violence and their dependent children, and provide education about family violence to communities across the state. We have a figure for state funds for 11 of $4.4 million. We have totally eliminated the state funds for this category, replaced with federal TANF funds, so the state amount in this category will be zero. Next, federal eligibility benefit services. These are really the frontline caseworkers, high volume processing intake of applications at the county defects offices all across the state for Medicaid, TANF, and food stamps. These are very, when we talk about protecting frontline caseworkers, primarily this is one of the areas, this is the primary area that we're referring to. You have currently state funds, $93.2 million. We have the reductions that I've referenced. We have the redistribution of unemployment. And here we have a recommendation in this category for fiscal year 11 of $94.2 million. Next category is out-of-home care. Out-of-home care are dollars to provide a safe and appropriate temporary homes for children removed from their families due to neglect, abuse, or abandonment. We have a figure, state figure of $65.6 million. We have a replacement of R funds, and we've made a substantial cut in this area, both in 11 and 12. And I'll tell you, one of the main rationales for that cut is the department has done an excellent job in moving children to permanency. And by permanency, the department is referring to stable homes, either an adopted environment, in their normal home with a relative, but not in a child caring institution. So the utilization of these facilities has decreased. So therefore, we have made substantial budget cut offerings in this area. So you'll see that reflected to the tune of $7.1 million. So we have a net for fiscal year 11 amended of $59.6 million. Next category is for fiscal year 11 is support for needy families, work assistance. These dollars assist needy Georgia families achieve self-sufficiency by obtaining and keeping employment, complying with the Georgia State Plan for the TANF program. You heard me reference earlier the work participation requirement for TANF. You have state funds here, $3.5 million. We have reduced this figure based on a decrease in utilization. There are more people that are on the work rolls with regard to TANF, so you'll see a recommendation for this category down to 0. This item has been zeroed out. That's fiscal year 11 amended. So I think we'll go through fiscal year 12, the full year. A lot of these figures will be reflect the same rationale for the same programs, same services that I just went over for 11. Some of these figures with regard to statewide reductions, unemployment insurance, contractual reductions, same contracts, annualized figures. So we'll start with, once again, with adoption. We have current state funds projected for fiscal year or budgeted for fiscal year 12. Governor's recommendation of $31.2 million. You see an enhancement here with the replacement of the lost R funds, and that takes the recommendation to $34.3 million. Child care licensing, very similar to 11. We've zeroed out state dollars, replaced with federal TANF funds. So your state figure for this for 12 is also 0. Child support services, start with a figure of $20 million, end up with a figure of 24.5, primarily reflected in the replacement of the lost funds from R. Child welfare services, start with a figure of $89.4 million for 12, end up with $89.5. As I said earlier, the contractual cuts that are reflected here are for the Accenture contract and the technical adult education contract. Department administration, same thing here, annualized figures. We end up with, we start off with $37.1 million, end up with $33.4. We have that transfer of telecommunications funds to DCH and DBHDD, and also the reflect software licensing cost. So you end up here with a figure of $33.499 for fiscal year 12. Elder abuse investigation and prevention, we start out with the state fund figure of $11.7 million. We end up with $11.882. You see reflection of the administrative redistribution for unemployment insurance, and that's the recommendation for this program for 12. Elderly community living services, we start out with $55.7 million. We have a replacement of EPMAP from R with a substantial amount of over $11 million. It brings the governor's recommendation for this area for 12 to $65.4 million. You're going to hear a lot later on from DCH and from Dr. Shelp in mental health about the settlement with the Department of Justice and the funds necessary to implement that and to move people out of both state hospitals and also institutions into the community. This is part and parcel of some of that effort. It's all wrapped up in that concept. I talked previously in 11 about the contractual cuts, and they're reflected annualized here in 12. Elder support services, current budget 665, recommendations 666. The only real, beyond those administrative OPB reductions across all programs, the change here is the unemployment redistribution. Excuse me. Family violence services for 12. This is similar to 11, where we've zeroed out those dollars, replaced them with federal TANF funds, so the state figure for 12 in this category will be 0. The eligibility benefit services. The reference to new here refers to the fact that we've created a new program budget that combines the determination of eligibility for food stamps, Medicaid, and TANF, and the support for needy families into a new program budget category deemed federal benefits services. You'll see here a starting point of $93.2 million. The categories we've gone over ended up with a recommendation of $94.9 million. Out-of-home care, also here as with 11 for 12, we've offered up a substantial cut based on a decrease in utilization to go from the current 65.6 to 60.6 net. Excuse me. And finally, for 12, support for needy families, work assistance. We've zeroed out these dollars. We started with 3.5, with a decrease in utilization of this category. This will be 100% federal, no state dollars, and this presentation is meant to address state dollar figures. So we're zeroing out this category for the state, and that was reflected in 11 as well. Mr. Chair, that concludes our formal presentation. I appreciate the opportunity to be here this morning. I look forward to having a continued dialogue and cooperation with your committee, General Assembly as a whole. We have folks here who can answer specific questions, and we're happy to do that. But that concludes our official presentation.
Thank you very much, Clyde. Representative Ash, have a question? Your light was on. All right. Representative Knight, is that you?
Thank you. My question, two questions, were going back to TANF funds. You had mentioned that we had to have a state match, and the portion of that state match was coming from outside sources.
That's right.
That's my first question. I'm curious what those outside sources are.
Mm-hmm.
My second question goes back to something that I learned in the district, and I guess I was very shocked to see. But under the TANF program, we were actually repairing people's cars. Actually, a constituent who had a repair mechanic store or mechanic shop said that somebody came in and said that we needed $1,000 worth of repairs to my car. You had to do it. And so he ended up finding close to $1,000, but that $1,000 was paid from the state of Georgia through the TANF fund program to put new tires on somebody's car and to give it a tune-up. I'm just curious, is that really what we should be doing right now with taxpayer dollars?
Well, I'll address the second part first. I'm certainly not aware of that. I don't know why that would be. Certainly doesn't sound something that I happen to agree that states should be doing. But whether or not that's actually the case,
well, I do not know. I actually saw the invoice. He actually got a copy of the invoice for me, and I actually saw the invoice. And I wonder.
We have someone here who can help us answer that.
I would be very interested to hear why we're spending Georgia tax dollars.
Okay. This is Cliff O'Connor, who's a budget expert in TANF defects. He can help us answer that.
You may want to go up there so everybody,
please.
The way the TANF program works right now is our major goal is to get people engaged in work activities, and we have to meet hourly work activities. Transportation is one of the biggest barriers to getting people involved in work activities. In the metro areas, we'll often buy people bus passes or rail passes and those kinds of things, but especially more rural areas of the state, we have to get a little bit more creative to try and get people to work activities. So there certainly are instances out there where, based on the circumstances in the home, we may pay for a car repair because we think that's the most cost-efficient way to get a person engaged in the work activities and move them back to self-sufficiency. Jumping to the question that you had before about the external match for maintenance of efforts on TANF, the big categories that we have there, the single largest one is from the food banks across the state. We work with them to measure the dollar value of the food that's distributed to TANF-eligible clients around the state, and that's running at about $32 million right now. We're also working very closely with our partners in terms of child placement agencies, child caring institutions. Many of the agencies that we place children with, say in a group home, they also go out and raise private funds to enhance the services provided by those group homes. And so then we can, by working collaboratively with those group home agencies, report the private match that they use on top of the money that we give them. There is also some additional money that's coming in from DECAL that we report. It's external to us. It's still part of the state, related to certain aspects of the pre-K program that under TANF regulations we're allowed to count. So those are the three biggest categories.
Mr. Chairman, one further question. When I looked a little bit up under the services that are coming up under TANF, I noticed that we were actually paying people once they find employment, that we're actually, for up to a year, we're actually paying them to stay at work. And I'm just curious that in today's times, when I remind everybody that government cannot give away for which it first does not take from someone else. Mm-hmm. And it seems sort of counterintuitive that we're giving money to keep people and incentivized to keep working once they found a job. And it's just sort of counterintuitive.
In general, what we're doing in Georgia is Georgia generally has a very low cash benefit assistance amount. And what we're working with is to get people in the labor force and then get them attached. What we find is that many of the TANF clients we deal with have major issues about their attractiveness to the workforce. Mm-hmm. So what we have tried to do, and it's certainly open for debate, is that we've tried to incentivize our clients as much as possible to remain in the labor force, because many of them don't have good work histories, rather than trying to come back onto the TANF cash assistance. So in a state of $9.6 million, we only have about 3,000 adult-headed TANF cases that have to work, because we've really driven down our caseload so far by really having what's a very intensive work-first attitude in our TANF program.
Mr. Chairman, one last question. I'd just be curious if we could maybe get a little more detail as to how much money we were spending in these different divisions within TANF, how much money went to repairing vehicles, how much money went to, I think that would be a good analysis to look at.
Very good. Senator Hooks.
Hey, Mr. Chairman. My question is more to do with accounting and explanation than anything else. Under Elder Community Living Services and Elder Support Services, in both cases you're using tobacco settlement funds. And they're the same in the supplemental budget as they are in the big budget, or the FY12 budget. Why tobacco settlement funds here and nowhere else? And why, how long I assume that figure's been in there for a number of years. I just have not noticed it.
Okay, I'll let Lynn Belanger, our Chief Financial Officer, address that.
I'm going to let somebody from Aging help us here, but we receive very few tobacco settlement funds in the Department of Human Services. The only place we receive is in Aging. Most of them are used for other health areas, but that's a OPB question.
Yes, the tobacco funds have been in those programs for the better part of the last decade that I can tell, as far as I've seen back. They're used primarily in the Medicaid waiver program, CCSP, which are services to, the rationale is services to former smokers who require services. They're also used or have been used in long-term care ombudsman programs to benefit long-term care residents, facility residents, and have been used in to match some grants in the Georgia Cares program, which are for which are to provide assistance with Medicare Part D and items like that. As far as I know, they've been there since the settlement. So
with regard to the actual accounting aspect of that question, I'll consult with OPB and we'll get a more specific answer on that particular piece for you. Thank you.
Senator Grant.
Thank you. Commissioner, you seem to be very concerned about the maintenance of effort levels and the dollars that we have from the state budget to maintain that level. My question, I'm sure that many other states are in similar predicaments. Has the federal government been approached about relaxing some of those maintenance of effort requirements in this economic times?
I'm not aware of any effort in that regard. I know that part of the TANF block grant is up for congressional reauthorization, but as far as any attempt to relax that maintenance of effort figure, I'm not aware of any. We can certainly check and find out.
Okay. And another question unrelated to that, are you still doing some of the support services for the Department of Behavioral Health, or does this budget move all of those support services out?
I believe we are still doing some things in conjunction with them in that ramp up to them being a totally independent agency. So I think there are some dollars reflected still for that. We can get the actual specifics, but I believe there are some shared services still around.
And is your department being, accounted for in getting credit for that effort?
I believe we are, yes.
Okay.
Senator Tate.
Mr. Commissioner, I refer to the departmental administration on page 217, item number 6. It says here that we're recommending placing $99,000 in state funding with the social services block grant, and I want to know if this is for the transportation for the elderly, if this is going to be new block grant funding for aging to deliver transportation services, or is this funding going to be going from the long-term care ombudsman or the adult protective services or Meals on Wheels programs that we currently have?
Lynn, do you know the answer to that? I'm sorry, I'll need some help with that one.
I might need a little help too, but it's really a switch between state and federal funds. This was in our effort to reduce our state fund as required in our reductions. We were able to identify a little bit of SSBG money that would be able to be switched for that. So the level of service really hasn't changed. It's just allowing social service block grant to cover that as opposed to state funds. Is that?
So it's not going to be new block grant funds? It's going to be money that was there that you just found, basically?
Well,
no?
It's as with everything else with this budget, it's trying to arrange for reductions where possible. This was allocating more social services block grant money to transportation than has been allocated in the past.
Thank you.
Representative Hughley.
Thank you, Mr. Chairman. Mr. Commissioner, would you speak to the transfer of the Family Connection Program out of your department to the Governor's Office of Children and Family? I've gotten several questions about that, and I just want to make sure I understand what the true explanation is.
I'm aware that was part of the governor's recommendation for fiscal year 12. I've become aware this week that is an agency that has been attached to the Department of Human Services. I'm not up to date as I stand here today on what the rationale for that move is. I can certainly consult with OPB and the governor's office and get a more detailed answer. But all I'm aware of as I stand here today is the fact that it is in the governor's recommendation.
Representative Pruitt.
Thank you, Mr. Chairman. I want to clarify one item we were talking about, the Meals on Wheels and things like that. Looking at the budget, it looks like to me that we had over $1 million that we came in from the federal government has now been taken out. Have we somehow replaced that money? It looks to me like that we're going to be short about $1 million in that program.
I'm sorry, what page are you on?
218.
Okay. You had that? Okay. Can you address that, Lynn?
There's one area where subsidy was not replaced with our funds replaced.
Okay, I think this is one area where there actually will be a reduction. This is one area where the R funds were not actually replaced, so that will be a cut in that for that $1 million. Most other instances, OPB helped us restore the lost R funding. That $1 million in that category, my understanding is that was not restored.
Well, I appreciate you being honest. I do have a great concern about that because that is a good program, and it's been around for years, and I understand we're in hard times right now, but we're serving close to 30,000 people under that program now. We've got about 20,000 on the waiting list, and it's really a huge concern of mine.
Well, I appreciate that. We're certainly mindful of it, and as things move along here, we'll see where that goes.
Mr. Chairman, I have one other question, if I could, please. Another question, please.
Yes, sir.
I don't really know where this is in the budget, but I do have a concern that we, the state, and I don't know under what department exactly a line item it is, but when we have parents that are not paying child support, we step in and fund a certain amount to those children through the state to bring it up to a certain level, even when the parent's supposed to be paying child support and they're not. My question is, how active are we at trying to receive that money and get that money that's child support that's due the state to keep the state from having to fund the difference? And is that number increasing or decreasing over the last few years?
I'm going to ask Mr. Keith Horton, our Director of Child Support Services. He can address that in a way I think will specifically answer your question.
How you doing, sir? In regards to child support and in regards to collecting child support on foster care as well as TANF recipients, we have done an outstanding job of doing that. As a matter of fact, we put back into the state treasury about $9 million per year back into the state treasury from TANF recipients on those individuals that we collect child support from. And so we have a very aggressive program where we collect that child support. As a matter of fact, last year we collected $650 in FY09 we collected $650 million for the families in the state of Georgia. And last year we collected $675 million for the families of Georgia, and that's in spite of the economic downturn.
Well, thank you for that answer, but my question would be on the other side. How much have we not collected? And what is it really costing the taxpayers of Georgia to fill that gap?
Well, right now we have about, there's probably about a couple $100 million per year that we're not collecting in child support. But when you look at the number of non-custodial parents that are paying, we have a steadily increased the number of non-custodial parents that are paying on a consistent basis, as well as those who are making partial payments. And so our increase over the years, the number of non-custodial parents that are paying on a regular basis has increased dramatically over the last several years.
One follow-up, if I could, please, Mr. Chairman. Have we looked at any other avenues to be more aggressive in collecting this money and basically getting some of the burden off the taxpayer?
I think we've looked at every aspect. We were privatized, partially privatized several years ago, and our collection rates were extremely low. Since we've taken over that privatization, our collection rates have gone up dramatically over the last couple of years. And every year we have increased the increased amount of child support that we've collected about 20 to 25 million each year. And so we have very aggressive approach. As a matter of fact, we have moved dramatically in the rankings as compared to other states in the Southeast as well as the nation. So we're one of the better child support agencies in the Southeast, and one of the better, and probably one of the mid-level child support agencies across the nation.
Okay, thank you very much. I would like to talk with you after the meeting privately if I could.
Absolutely.
Thank you.
Representative Hurd, last question.
Thank you, Mr. Chairman. Congratulations, Mr. Commissioner, on your appointment.
Thank you, sir.
I wanted to kind of follow up on a question about the supportive services for a person who is working that needed transportation. As a former chair of the Northeast Georgia PIC Workforce Development, it was not unusual to assist someone who needed their vehicle, in this case, fixed because one of the largest barriers, the biggest barriers to employment was transportation for a lot of individuals. And after you spent a lot of state dollars and federal dollars on training that individual, you would do all you could to make sure that that would not be the thing that would not keep them from working is transportation. Mm-hmm. So it's kind of like you want to return on your investment. So do you repair the vehicle, or do you tell them to not work and get back on the welfare caseload? Mm-hmm. So that was something that I know we did at that time, and it was just a matter of, you don't want to do a lot of those, but there were those cases where individuals who were in rural areas did not have transportation, no bus service, and that was something you did to make sure that they stayed off of the welfare rolls.
Right. Thank you. I appreciate that background.
All right. On the maintenance of effort, this seems to be coming pretty close now. As I recall, Georgia has not really we were always toward the lower tier of the amount of dollars that we could put toward maintenance of effort. Mm-hmm. And when you look at some of the other states, and I guess my question is, you're saying basically that at 7%, we are really in jeopardy if those cuts are if you have a 7% hit, and maybe even a 4% hit. And how many dollars are we talking about? Maintenance of effort dollars as compared to state dollars. What would be the difference?
Well, what we've looked at is we had a projected deficit of around 13.9 million state dollars with the 4% cut. Anything over that would increase that amount. So that's what we've tried to go out and contract private providers, make in-kind contributions to cover that hole. So that would go up if the 4% cut went to 5, 6, or 7, or whatever the case may be. So that's my reference to where we're right on the line there.
So that 13 million brings how much in federal dollars?
Lynn, do you know? Is it 13.9 million? How much does that relate to with regard to federal dollars in the block grant?
It brings no additional federal dollars. It just avoids a loss of federal dollars.
Well, how much of a loss would it be if we didn't maintain that maintenance?
If we didn't maintain the 13.9 million, we would lose 13.9 million in the TANF block grant, and our required match in maintenance of effort would go up by 13.9 million. So it's basically a 2-for-1
2 for 1. Okay.
Right. As I indicated, it's a dollar for dollar. So when you go down the required maintenance of effort, you lose the money from the block grant, then your requirement goes up. So it's on both sides.
Okay, thank you.
Well, it turns out that wasn't the last question. We have a postscript from Representative Knight.
Actually, it's one separate question. May I ask, from a perspective of all the different programs that obviously are falling up under your agency, Department of Human Services, do you track the number of individuals who qualify for multiple programs? In other words, we sort of look at this piecemeal in this program and this program. Do we have an ability to track and quantify the number of people who qualify for programs all the way across the board and and quantify that number and that dollar amount?
I believe we do. I know when you go to a defects office, you don't know when someone comes in the door whether they're going to qualify or apply for Medicaid, TANF, food stamps, one or two of the three. So one of the things we've talked about is having an eligibility system that has one front door that be seamless to the consumer. But whether or not we know right now the figures associated with each, I can certainly find out for you.
And again, not at the individual level, but I would be curious to know, for example, the number of persons or families that X number of programs and X number of dollars that they are receiving
for each program. Yes, sir. I understand.
I don't know if we could get that, but that would be
great. We'll certainly look into it. If we can, we'll get it to you. Thank you.
Clyde, thank you very much for coming this morning.
Thank you, Mr. Chair.
Good luck, and we look forward to working with you.
Thank you. Appreciate it. Thank you. Appreciate it. All right.
Johnny. Okay, ladies and gentlemen, take your seats, please.
Scared Butch when did you see him jump?
Thank you very much, ladies and gentlemen. Wow. That's amazing. Yeah. Ladies and gentlemen, the thing I remember about David Cook when he was Nathan Deal's aide back in about 1991 or 2 was that he was always well prepared. And so as I look around this wall here, David, you hadn't changed a bit.
Thank you, Mr. Chairman, Chairman England, Chairman Hill. Members of the Appropriations Committee, I want to thank you for this opportunity to present the Governor's proposed budgets for the Department of Community Health. Let me begin by saying what an honor it is to serve as the Commissioner of DCH. I'm excited about this position. As those of you who know me know that I believe strongly in the Department's mission, providing Georgians with access to affordable, quality health care. We believe that the best way to achieve that mission is through responsible planning and the efficient use of our limited resources in a way that promotes healthy behaviors and improves health outcomes. So I look forward to working with you and the members of the General Assembly as we work together to pursue that mission. As you know, DCH is the lead agency for health planning and purchasing in the state of Georgia. DCH is designated as a single state agency for Medicaid and the State Health Benefit Plan, which provides health insurance coverage for Georgia teachers, state employees, retirees, and their dependents. Combined, these two divisions provide health care coverage for approximately 1/4 of the state's population. In 2009, as you know, the General Assembly also transferred health care facility regulation, public health, and emergency preparedness and response to DCH. This has substantially increased the breadth and scope of our operations. Like the state of Georgia as a whole, DCH is facing a number of significant challenges, but we must not and should not try to tackle these challenges in isolation. I'm looking forward to working with all the providers who care for patients, as well as all the vendors who make it possible for us to move forward on key initiatives. And I look forward to working with the citizens of the state of Georgia. DCH will be a good listener. We will always seek to understand the concerns that our citizens raise, and we want to address those concerns to the very best of our ability. In terms of the transition of leadership at DCH, let me say that it has gone exceedingly well. I want to publicly commend Commissioner Reese, who has been very helpful and supportive during this transition. I've met with both Commissioner Reese and Commissioner Schelt and committed to them that I want to work with them on healthcare issues that intersect and overlap our respective departments. And I've had the pleasure of meeting with and working with now many of the staff over at DCH, and I have to tell you I'm very impressed with their competency and professionalism. I may call on several of them today to help me out with some questions. Vince Harris with our finance, and Scott Frederington is right here also, our budget person. Finally, let me just simply say to you that I will be a good steward of all the valuable resources that you may decide to appropriate to DCH, and that I look forward to working with you. With that, let me begin the budget presentation in general. The first slide here gives you a little bit of an overview about the DCH budget. It is a large budget, particularly when you look at the federal funds that are included, $12.1 billion. Of that, $2.07 billion are state funds. Of the state funds and the Georgia budget that is allocated to DCH, most of it goes to Medicaid, which is the age, blind, and disabled, and the low-income Medicaid. Those two populations together, you can see in the brown and the purple there, comprise about 84% of the DCH budget. Peach Care for Kids is also under our jurisdiction, which represents only about 3.3% of the budget, and the other areas you can see there. We have 19 programs that we administer at DCH. I'm going to be going through this line by line. Obviously, if you have questions, I'm more than happy to entertain them. We have put together this presentation to give you a comparison. Hopefully this is a helpful way to do it, to compare the FY11 changes in the one column and the FY12 changes in the second column. And many of these items you'll see, and we've done this by program area, you'll see reoccurring throughout various program areas. The first is to provide an adjustment workers' compensation premiums. You'll see that throughout programs, and this is applied statewide to all agencies. Number two, item 2 reflects an adjustment in telecommunications expenses of $901,000. And this represents an adjustment recommended by the Georgia Technology Authority and the Georgia Enterprise Technology Services Billing. Some of these issues, let me pause here for a second and say, relate to the transition of public health over to DCH. So you'll see some significant budget adjustments based on what we see or what OPB indicates as actual costs. Number 3 is a transfer of state funds to the Department of Human Resources related to that conversion. Again, that's about $2.5 million in each year. Number 4 is reducing funds for personal services. These are positions that are vacant and were being held open, and you'll see that throughout the various program areas in the department. That particular line item in this area is about $150,000. We have consolidated space. In item number 5, you can see the savings from that over at our headquarters office at 2 Peachtree in Atlanta. Number 6, we are transferring funds from the low-income Medicaid program to fund the Medicaid Management Information System conversion costs. This is an important item as we, excuse me, I think the, the staff at DCH should be commended on that conversion. Many of you remember the ACS conversion several years ago. I certainly remember that. This one went superbly well, and staff is to be commended on that. We are, as we complete this conversion, we have not yet been certified by CMS, and because of that, our match is only 50%. So there's a process that we have to go through until we obtain the 75-25% match. We expect that certification, which is on track, to be completed by the end of the year. Item number 7 is to reduce funds for computer contracts related to that conversion. There are a couple of contracts that HP will be taking over, and we will not need to independently contract for those services. Excuse me. Number 9, we are replacing state general funds with other funds that come from global settlements related to various national fraud and other type cases where there are settlement amounts, and this is a pro rata share that the various states share in, Georgia included in that. You'll see that item in a larger proportion in the Medicaid budget. And item number 10, we increase funds to reflect the adjustment of the employer share for the employee retirement system, and you'll see this item throughout. Moving on to adolescent and adult health promotion. The Adolescent Health and Youth Development Department offers services in communities throughout Georgia. We have 30 program sites in 27 counties. They are strategically located throughout the state in areas where high school dropout and teen pregnancy rates are amongst the highest. You can see some of the statistics there and some of the services that we provide and the volume that we provide. Item number 1 in this area, again, you'll see this recurring, reducing funds for personal services, keeping vacant positions non-funded. We're reducing operating expenses by about $350,000 in FY11 and FY12. We're reducing programmatic aid to the County Board of Health, which is funding for the various programs and services they offer on the local level. That is approximately $23,000 in FY11 and $35,000 in FY12. Item number 4 is to reduce funds for contracts as we streamline. Item number 5 is to just do a swap on tobacco funds of $87,000, so there is no budgetary impact to DCH on that. We're replacing other state funds with the tobacco funds. And number 6, again, is the item related to funding the employee retirement system. Moving on to adult essential health treatment services, you can see some of the program metrics there. We provide well over 2,000 cancer treatment services to over 360 clients, provides care to eligible low-income, underinsured, and uninsured cancer patients, and we also are involved in hypertension management, which is responsible for the stroke and heart attack prevention program. That is the SHAPP program, which provides services again to low-income, uninsured clients with blood pressure monitoring and blood pressure medications. We serve over 14,000 clients in that area. Item number 1 in this area recognizes savings of moving many of these clients to a new federal program called the PSIP program, the Federal Pre-Existing Condition Insurance Plan. It is a new federal program, and it's our understanding that these clients are going to be getting the same service that we provide at the state level through this new federal program. So we're going to be recognizing savings there in both FY11 and FY12. Item number 2 is a tobacco settlement fund swap with state funds, so there's no budget impact there. And again, increasing the amount for the employee retirement system. Moving on to emergency preparedness. Very important part of our department, preparing for natural disasters, bioterrorism, and other emergencies, as well as improving the capacity of the state's trauma system. The item number 1, you can see some significant cuts in this area. We're reducing funds for the trauma registry contracts, which is the funds that the state pays to trauma centers to collect and report certain data that have been established by the American College of Surgeons so that we can collect this on a statewide basis. We are planning on ceasing funding for those contracts, but it's my understanding that that information will continue to be collected. Item number 2 is that there will be an increase in the funding, again, for the employee retirement system in that program area. The next program area is epidemiology. Obviously, another important function of DCH. Epidemiology program monitors, investigates, and responds to disease, injury, and other events of public health concern. It conducts surveillance for more than 75 notifiable diseases and conditions in FY10. Infectious diseases, chronic diseases, and disease outbreaks. In FY10, we investigated 171 events of public health significance, of which 102 were confirmed as disease outbreaks. The typical 3 etiologies that we track, or at least in 2010, were the biggest ones were the norovirus, salmonella, and influenza. In this area of epidemiology, you can see item number 1, again, is reduction of funds for personal services, holding vacant positions open, which is about $104,000 to $158,000. Reducing the programmatic grant and aid to county boards of health at about $84,000 in FY11 and $141,000 in FY12. Item number 3, to reduce funds to the Georgia Poison Control Center. And this is a contract that is with the Fulton DeKalb Hospital Authority poison control contract managed by Grady Hospital. Number 4, we discontinue laboratory testing that is available through the private sector. There are 3 types of tests that we are going to cease providing. Those tests relate to checking the fluoridation of water, checking well water, and HIV testing. This is the one that relates to this is the HIV testing, I believe. So you'll see that in other program areas as well. These tests are available in the private sector. They're well utilized in the private sector, and the state basically has decided to get out of the business of providing those particular tests. The number 5 is the employee retirement system increase, which is in FY 2012. And item number 6 reflects the discontinuation of the increase of the stimulus FMAP funds available to the Georgia Poison Control Center. So we're getting some additional money through better management of the stimulus funds that are available. You'll see that pop up in a number of different areas where we move the year in which some money is paid out so we can take the best advantage of the highest FMAP rates and other government programs that will be available to us. The next program area is healthcare access and improvement. We provide grants and other support services for programs that seek to improve health access and outcomes in rural and underserved parts of Georgia, primarily through the State Office of Rural Health and the Office of Health Improvement. This is an area where we also administer the Certificate of Need program function. In this particular area, again, you can see item 1, we make an adjustment for the workers' compensation premiums. Item number 2, we reduce funds in the area health education centers, about $70,000 in FY11 and $106,000 in FY12. Number 3, to increase funds as an adjustment to the employee retirement system. Again, that's a retirement issue. Number 4, recognizing savings from the integration of health improvement and public health programs. This is one where we are merging several programs together with the Office of Rural Health, Health Planning, Georgia Volunteer Doctors, and some health technology funds in order to streamline some of the operations and achieve some savings there. Item number 5 is to reduce the one-time funds for the Erlanger Life Force Air Ambulance Program. That's a FY12 adjustment in the amount of $600,000. The next program area is health facility regulation. The purpose of that is to inspect long-term care and other health facilities. In FY10, there were 14,462 active facilities that were licensed and certificated by this program. There were nearly 3,000 inspections completed in FY10. As you can imagine, we don't have the ability and opportunity to inspect all facilities annually, so we do that on a rotating basis. In FY10, we received just over 2,500 complaints against licensed providers. In this area, in item number 1, last year's budget included additional funding for 6 additional staff people to help with this. That funding has been eliminated in both FY11 and FY12. This has been an area of some concern to DCH over a number of years, hiring and providing the qualified staff to conduct inspections of facilities. We are looking for ways to improve that process and putting greater emphasis on how and who we hire to do those inspections. Number 2, we eliminate funds for adult daycare licensure. As I understand this is a recent piece of legislation that passed, and it's specified, as I understand it in that legislation, correct me if I'm wrong, that it was to be carried forth only if funds were made available, and I don't believe any funds have been made available for that yet, and they are not included in the FY11 and FY12 budget. Item number 3 is reduced travel in the FY12 budget of $128,000, and item number 4 is again the statewide change for the employee retirement system. This next slide is an interesting slide. Immunization is one of the key services that we provide that keeps Georgians healthy. You can see the data there. We immunized in FY 2010 almost 2.5 million people through these services. If you look at the budget items there, number one is to reduce current operating expenses, and before you fall out of your chair, at $1.8 million in reduction, there is actually federal stimulus funds that is available for this, so we're going to be able to take advantage of the federal stimulus funds and replace and not have to use state funds in that particular area. So basically a no change in that. And again, an increase in funding related to the employee retirement system. Indigent Care Trust Fund program, which is designed to support rural and other healthcare providers. It's primarily for hospitals, and it's related to the service of the volume of medically indigent patients. The disproportionate share hospital program, I'm sure you're very familiar with. It's a federal program that allows for adjusted payments to hospitals that serve significant disproportionate number of low-income and uninsured patients. And in order for the state to participate and receive the federal funds, all hospitals that meet federal requirements as disproportionate share hospitals, also known as deemed hospitals, must be included in the state's allocation method. You can see there's a nearly $8 million payment in order to accomplish that, and this will allow us to draw down significantly more than $200 million in federal monies. The next program area is infectious disease. Again, you can see some metrics there. Over 16,000 patients have received education in risk reduction sections, HIV testing, core medical services. And these services are provided to help ensure quality and prevention and treatment of HIV, sexually transmitted diseases, tuberculosis, and other infectious diseases. In the budget area, you can see again the lab services change there, $268,000 reduction in FY11, $421,000 reduction in FY12. Again, these lab tests are available in the private sector, and so the state plans on discontinuing those at the public health departments. You can also see item number 2 is the increased funds for the employee in the employee retirement system. Infant and child essential health treatment services. Again, you can see some of the metrics there. More than 100,000 children receive physical assessment and health care screening. 50,000 children have received dental screenings. Again, these are FY 2010 data. And the purpose of these services is to avoid unnecessary health problems in later life by providing comprehensive health services to infants and children. Item 1 in the budget area is, again, you can see a reduction in personnel, cut funding from the vacant positions that we have. Item number 2 is the programmatic reduction in grant to aid for the county boards of health, $167,000 in 11 and $450,000 in FY12. Item number 3 is to reflect savings from the phase-out of the Babies Born Healthy program, which I understand has been being phased out over a period of time now, and that will complete the process. Number 4, again, is the increase funds for the employee retirement system, the amount of $15,000. Infant and child health promotion program information. Again, this is an area where we provide education and services to promote health and nutrition for infants and children. These services are provided to more than 300,000 women, infants, and children. Information regarding nutrition and breastfeeding support, those kind of services are provided in this program. Item number 1, again, is reduction of funds for personnel. This is, again, vacant positions, $854,000, $835,000 in 2012. And we hope to reduce operating expenses in this area through consolidation and downsizing, not in FY11, but in FY12 of nearly $500,000 there. We also recognize some contract savings in item number 3 from moving the high cost of the hemophilia population to the federal program that I discussed earlier known as PSIP. Item number 4, we reduced funds for contracts in the amount of $20,000 and again increased funds as our share for the employees' retirement system. Item number 5, inspections and environmental hazard control. We do many things in this area, inspect food service facilities and programs. We did over 62,000 inspections in FY10, inspections of tourist accommodations such as hotels, motels, campgrounds, etc., swimming pools, spas, recreational and water park areas, well water supply facilities. We have a chemical hazards program that conducted 11 community assessments related to chemical hazards in the community and rabies control and other environmental hazards. In the budget, item number 1, as you can guess, is reduce funds related to personnel services, $73,000 in 2011 and FY12, $37,000. We also hope to achieve some operating expense reductions there, about 112 in 11 and about 213 in FY 2012. Item number 3 is a repeat again. This relates to the lab testing that I had talked about earlier, well water testing and those kind of tests that will be available in the private sector, and you can see we save some money in that area. Item number 4, again, is the item related to funding for the employee retirement system. Moving on to the public health formula grants for grants and aid for county program information. I'm sure you all are familiar with the grant and aid program. We provide over $61 million of state funds to local boards of health in return for the basic delivery of healthcare services. Counties have the discretion to allocate these funds at the local level as they see fit, and historically most of these funds have gone to pay for clinic staff and to purchase supplies. In FY 2011, the Georgia General Grant and Aid, sorry, thank you, ranged in counties from the low of $48,000 to a little bit over $5.6 million to other counties. I understand there has been an ongoing effort to take a look at that formula that many of you have participated in with our staff, and I understand that there's been some very good work done on that. That formula, I believe, was based in the 70s, maybe, and there's a need to update that formula. The state has discretion as to how that money gets spent. You'll see in the budget there that there is a $2.5 million reduction in the global amount of funds related to grant and aid to the counties. Item number 2, again, is our reduction for employee retirement system, an increase based on the employee retirement system. The grant and aid reduction that you see here is a 4% reduction. That brings us to vital records, obviously another important part of state government where we maintain records of all births and deaths, marriages and divorces, etc. For Georgia residents, we've got those records, as I understand, going back to 1919. Just in FY 2010, we recorded 135,000 births and about almost 64,000 deaths registered. And obviously the purpose of this appropriation is to continue that registry and archiving process. In FY11, you can see again the reduction in funding for vacant personnel places, 97,000 in 2011, 153,000 in 2012, and the increase in funding for the employee retirement system for those personnel. That brings us to the big one, Medicaid and Peach Care. The first slide, I think this may have been presented over years in the past. I think it's an interesting slide. You can see the graph here, and the black line shows the national average of Medicaid expenditures per person. And the red line, you can see that Georgia, since about FY 2006, has done a good job in keeping expenses below the national average. 2010 data, interesting, shows a pretty widespread, about 60% of what the national average is there. We included this next slide to give you an idea of who our members are. This is a combination of both Medicaid and Peach Care. We serve about 1.6 million people in both Medicare and Peach Care. About 6%, 95,000, are less than a year old. About 22%, which is the Burgundy area, up there are children from ages 1 to 5. In the yellow area, 40% are people ages 6 to 18. In the light blue area, about 23% are adults age 19 to 64, and about 9% are ages 65 or older. So as you can see, the vast majority of people that we cover in Medicaid and Peach Care are children. The next slide is just a tracking bar graph of CMO penetration in the state, the care management organizations. You can see the growth over the last 5 years. This graphically represents the low income and ABD membership in either fee-for-service or managed care. And as you can see, with the implementation of managed care in 2005 and 6, that population has continued to grow. Again, the biggest increase in the managed care population is related to children. The next slide gives you an idea. We have 3 CMO providers in the state, WellCare, Peach State, and AmeriGroup. Those market penetrations have remained relatively stable since the inception of the program. WellCare continues to have about 50% of the market share, and the rest of the market share split more so by Peach State, but almost evenly between Peach State and AmeriGroup. The next area, and probably the biggest, certainly the biggest portion of the DCH budget, relates to reduced funding of state funds of the addition of state funds of $131 million for Medicaid in FY11, and a whopping $683 million, almost $684 million in FY12. This is directly related to the replacement of the federal stimulus funds that have gone away. Those funds through the stimulus bill that was passed last year expired on June 30th, and this is the use of state funds to shore up what the federal stimulus funds had provided over the course of the last year. Item number 2 reflects the estimated savings from settlements from drug companies on a national level. I mentioned this earlier. This is a $10 million expected revenue from those. And while we don't know the specific amount because these are ongoing cases, we do seem to hit this mark relatively steadily over the years, so we're budgeting for that. Item number 3 provides funds related to the new health reform bill that reduces fee-for-service Medicaid rebates. This is a change in the rebate policy for Medicaid due to the national health reform. While we receive less of a rebate in the fee-for-service area, you'll see when we get to the managed care area that there is an increase in funding there. And actually, we make up more money through that. Item number 4 is a savings to be realized from the elimination of a couple underperforming contracts related to disease management for the age, blind, and disabled membership. We have various metrics in our contracts, and we hold people to those metrics, and when they don't perform, then we look at terminating those contracts. So apparently those clinical outcomes anticipated were not achieved, and so we plan on terminating those contracts. Item number 5, OPB is recommending a transfer of state and federal funds from the low income and age, blind, and disabled to the Peach Care program to align the budget with what they anticipate those expenditures to be. Item number 6, $86.5 million reflects the reserves that are carried over from, I believe this is the Peach Care program for those expenses. I guess it's Medicaid too, isn't it? Yes. Medicaid and Peach Care for the incurred but not reported claims, those claims that are incurred prior to the end of the year but not reported until after the beginning of the next fiscal year. Item number 7, replacing the care managed organizations payments to maximize federal financial participation in the CMO contracts. You may recall that we staggered payments to the HMOs last year, making 11 payments this year. We recognized in doing this budget that there is an increased federal match with stimulus funds through this fiscal year, so we're going to be paying the full 12 months premium cap payment this year to the CMOs, which will give us a higher match rate from the federal government and take those savings in the FY12. Item number 8 is again transferring those funds that I mentioned earlier from Medicaid to the MMIS conversion so we can get our MMIS system certified. And item number 5 is just replacing, it's a swap with no impact on DCH, replacing tobacco settlement funds with state funds in the amount of about $12 million. Item number 10, the reduction for hospital provider payment collections. You all will recall last year that there was a legislation passed that had certain hospitals participate in a provider fee. The amount collected on that is not as much as we anticipated or had budgeted. The figures here, $13 million in 11 and 13 million and 4.8 million in 12 reflect the funds that we are projecting to be more realistic than what we had in last year's budget. Item number 11 relates to the Medicare D clawback payment. It is a one-time restoring funds for that particular provision, which related to the federal implementation of the federal program of Medicare Part D. Item number 12 reflects an increase in the federal financial participation. The new rate has come out. It's a little bit more favorable to the state, so you can see some reduction in that by about $9 million in FY12. Item number 13 is a very important item, reducing Medicaid reimbursements to all providers with the exception of hospitals and the home community based services. Quite frankly, I was expecting a greater, and we had talked, the General Assembly and the public had talked about the impact of much greater decreases in that particular area. I was pleased that we were able to bring this in at only a 1% reduction, and you can see there is no reduction in FY11 and a $13 million reduction on that in FY12. The hospitals that are excluded from this cut are the ones that were participating in the bill that passed last year related to the provider payment collections that I've discussed just up above. Item number 14, increase existing member co-payments and implement a new co-payment for members of the TEFRA population and other Medicaid areas. So you'll see, again, that is not implemented in FY11, but is implemented in FY12 at about saving about $3.5 million. Item number 15 is a transfer of funds from the Department of Corrections to reflect the relocation of the medically fragile offenders to community nursing homes. According to federal guidance, the Medicaid would be available for services provided to inmates who became a patient of a hospital or a nursing facility, juvenile psychiatric facility, or an intermediate care facility for the mentally retarded. The recommendation is to parole approximately 15 inmates, of the sickest inmates in Georgia who are medically fragile, to a nursing home setting. That would save about $1 million. Item number 16 relates to the elimination of certain optional Medicaid benefits. Again, this is adult vision, dental, and podiatry service. The governor's budget recommends elimination of these optional services as an early step to an overall approach to looking at how Medicaid will need to be transformed under the new health reform bill. As you all know, 2014, we need to be gearing up now for bringing in about 600,000 additional Medicaid patients. That's an increase of about a third, I believe, of additional Medicaid patients. The federal legislation, both the stimulus legislation and the federal health reform law, contain provisions regarding the maintenance of effort, which pretty much severely restricted what states could do, not just Georgia, but all states could do in terms of changing how they make payments for Medicaid services. So you have to maintain all your current efforts. One exclusion from that is the optional areas. So there are big changes coming with regard to that, unless we see some change at the federal level. And until we see that change, we're going to continue to plan for the actual implementation of that law, which will be significant. Number 17, remove the CMO outpatient hospital reimbursement floor. Right now, the CMO plans do not cost settle for outpatient hospital services, but must pay 100% of the charge. By cost settling that, which is how the fee-for-service program does it, there'll be a savings of about $4.5 million to the state. Item number 18 in Medicaid reflects savings from the implementation of the Planning for Healthy Babies program at about $9 million in FY 2012. The item 19 reflects an anticipated bonus payment. Again, I think staff needs to be commended on doing this and doing it quickly, related to the reauthorization of the CHIP program. It was a bonus payment that we were able to meet, and we were able to draw down one-time bonus payment for meeting all the specifications in that reauthorization act. That takes me to Peach Care. Peach Care enrollment in Georgia, as you can see from the pie chart, is about 202,000, virtually all of whom are children. There's less than 1% who are not children in this program. And you can see in the Burgundy area, ages 1 through 5, we've got about 40,000 children. Ages 6 through 10, we have nearly 70,000 children. Ages 11 through 17, 85,000 children. Ages 18 and above, about 8,000, for a total of 202,000 participants in that particular program. In the budget area, you can see in item number 1 that we replace the care management organization payments. And again, let me say that the Peach Care is structured very similar to Medicaid, so a lot of the same issues you'll see being implemented for both Peach Care and Medicaid. Item number 1 is similar to what we had in Medicaid, where we replaced the 2011 care management payments to maximize the federal participation. That's that enhanced FMAP that we readjusted those payments for. Item number 2 is to provide funds to reflect the revised federal policies in the federal health reform bill. These are the savings that I referred to earlier in terms of the match payments that we, in terms of the Medicaid rebates that we saw in the Medicaid program. Number 3, we transfer funds from the low-income Medicaid to Peach Care to meet what OPB determines to be projected expenses of about $4 million in FY11. Item number 4, we recognize the reserves. This is the IBNR, incurred but not reported, portion of about $239,000 in Peach Care. Item number 5, we reflect an increase in the federal financial participation rate. Again, the Federal Registry published that. Again, it's a more favorable rate to the state, and we recognize those savings in FY12 of about $305,000. Item number 6, we implement new co-payments for Peach Care members 6 years of age or older, and we recognize savings of that of about $1.5 million in FY12, will not be implemented in FY11. Item number 7, reduced Medicaid reimbursements for all providers. This is the same as what we discussed under the Medicaid portion, and that saves the state approximately $700,000 in FY12. There is no reduction in FY11. And then again, we removed the CMO outpatient hospital payment floor for savings of about $590,000. That takes us to the state health benefit plan. I'm sure you all are very familiar with the state health benefit plan. Currently provides coverage to nearly 700,000 employees in the state, mostly teachers. They're the biggest portion, other state employees. And we provide, our attempt is to provide competitive and other commercial benefit plans and equality and access to high quality providers. The majority of plan is state employees, as I mentioned, and the audited figures for the reserve balance. This is an important point for appropriators. In 2010, the reserve balance was $17 million. Sounds like a lot of money. It is a lot of money, but that represents an average of 2 days of claims. So we're running on a very thin margin in the state health benefit plan. In the budget, you can see item number 1, we reduced expenses by eliminating, and I think this has already been accomplished, the open access plan, which is the PPO, HMO kind of combination that the state health benefit plan had. You can see the changes, savings of $110 million, excuse me, in FY11 and $235 million in FY12. The item number 2 is the flip side of that. Those are reduction in premiums that we won't be collecting because we won't be offering that plan. So we'll see some loss in premiums there, $18 million in FY11 and $37 million in FY12. Number 3 reflects programmatic changes that we've made to the plan, reflecting a increase in the spousal and the tobacco surcharges. Currently $40 for a spouse will be raised to $50. Currently $60 has been raised to $80 for tobacco usage. And you can see that we generate some funds in the $8 to $16 million range for those programmatic changes. Item number 4 relates to implementing the health reform law. There is additional expenditures for covering insurance as mandated by the federal government to provide coverage for early retirees, those who are under the age of 65. We provide 80% reimbursement for claims between $15,000 and $90,000. And an important note here is that the federal government set aside $5 billion total for what they call the Early Retirement Reinsurance Program. $5 billion total federal funds that are available to states, and they're also available to private companies. Big private companies I know have applied for this, as well as many states. Again, staff is to be commended because we were on this early on. We have already got $35 million on that, submitted our first request for payment, and we're actually ahead of schedule in what we thought we might get on that. So I'm not sure how long that $5 billion is going to last. It'll be there till it's gone, and we want to get in on that money as early and as quickly as possible, and we've got a good start on that. You can see the savings associated with that. Item number 5, again, reflects the cost of the National Health Reform Law, where we are required to cover 100% of preventive coverage by definition and regulation under the Federal Health Reform Law. That's $5 million in 2011 and $10 million expense in 2012. Item 6 is also related to the Federal Health Reform Law, where we provide coverage for dependents up to age 26. That's a $54 million expenditure in 2011 and a $113 million expenditure in 2012. Item number 7 is the flip side of item number 6, where we project the additional revenue related to premiums generated for those additional children coming on board or young adults coming on board up to age 26, $35 million and $74 million. The difference between the cost in item number 6 of $54 million and the revenue increase of $36 million in item number 7 is a cost being absorbed by the state health benefit plan of nearly $20 million for FY 2011. Item number 8 is the governor's adjustment to prior year reserves to reflect the audited reserve amounts of a net of $1.7 million. Item number 9 reflect the update in revenue, OPB's revenue and expense projections for the state health benefit plan, $74 million in 2011 and $18 million in 2012. Item number 10 relates to an increase in the state appropriation for the Department of Education. It's an interstate transfer of funds for non-certified school service personnel benefit expenses. The governor in his recommendation includes over $56 million in state appropriation to the Department of Education to support funding for non-certified personnel expenses. These non-certified school personnel include individuals such as cafeteria workers, school bus drivers, and such. They're the non-licensed individuals. The Department of Education will remit those funds appropriated to pay premiums related to the state health benefit plan. Item number 11 represents an increase in a per member per month billing for non-certified school service personnel. Again, this would be the additional premiums, I believe. Premiums are increased here from $162.72 on a per member per month basis to $218 per member per month. So there'll be an increase in the premium that will be paid there. As I understand it, this adjustment has not been made since about the year 2000. So there have been 10 or 11 years, maybe 12 years, where that rate has not changed, and it goes up in 2011. Item number 12 is an increase in employee premiums scheduled for FY 2012 of 10%. Item number 13, which will generate approximately $30 million. Item number 13, implement additional plan design changes for FY 2012 in the amount of about $37 million in savings. We are just beginning to take a look at what those programmatic changes might be in order to achieve those savings, but we're being asked to come up with $37 million in additional programmatic changes related to the state health benefit plan. Item number 14 was a provision that was in last year's budget related to direct billing. There is a cost associated with that, and the governor has asked that we delay implementation of that until the state's finances become a little bit more solvent. That brings us to, I believe, the final area, which is general obligation bonds. There's a very important bond issue here that I would like to ask your support of. It's $100 million in FY 2012. This relates again to what we need to be doing for the implementation of the federal health reform law and bringing on such a substantial number of new Medicaid patients. The bond issue would be for $10 million. There is a 90-10 match for this money. So we will be able to draw down $90 million by putting up $10 million here. This money will be used to create a new revised eligibility software program to determine Medicaid eligibility, and it's something that I believe we desperately need to do. The current IT system, this and with state health benefit plan, and in our area, I'll just speak for our area, the IT infrastructure is in need of help. This will greatly help in the Medicaid area, and we request your support of that. Item number 2 is we're asking for $500,000 in facility repairs statewide. That concludes my walkthrough of the budget. I hope I haven't put you all to sleep. My contact information is on this slide. I understand that you all have a photocopy of the slide presentation. I know I probably went through it somewhat quickly. Hopefully it didn't take too long, and I'll be happy to answer any questions that you may have. Thank you, sir.
There are some questions, David. Ladies and gentlemen, I'll tell you, we've moved into the next hour's presentation, so we're going to cover everybody's questions, but please make those questions very succinct, and if it's a question you can ask David afterwards, I'd appreciate it very much. Dr. Shelp's already here, and we're kind of on the downhill road here, so we'll get started. Representative Seltzer.
Thank you, Mr. Chairman. Commissioner, great to have you on board.
Thank you, sir.
I had the opportunity over the interim to meet with some insurance brokers that really outlined for me in detail the provisions of the 111th Congress's health care reform bill, and showed me how the provisions are such that for private companies that provide health care for their employees, if the employee's out-of-pocket expense increases by 5%, that private health care for that company is then kicked out of their grandfather status into the health care exchange, and thereby requiring businesses to take the full measure of every dollar for dollar of increases in health care costs, with nothing being passed on to their employees. When that was laid out for me in detail, I saw in great detail that in fact what the 111th Congress did was really orchestrate a public takeover of private health care. I have grave concerns about that. That matched with the individual mandate of the United States Congress mandating a private individual to purchase a private product against their will, again, to me, provides the kind of impetus that I believe we as a state, as we have through our lawsuits, to take actions to ensure we're not complying with things we don't have to, and we're not accelerating ourselves towards something that's not going to be in the best interest of all Georgians. With that as a backdrop, I would ask you, what's the department doing specifically to comply with this law? And are there things that we can perhaps take a wait and see approach on so that we're not complying in ways we don't have to, recognizing the court might take some actions that would again, I think, interrupt some things that would not be helpful?
No, it's a very important question. As you know, this governor has been an outspoken critic of the health reform bill, and I think one of the key components of that is the constrictions that are placed on state governments in a variety of ways. Your comments relate primarily to the private insurance market, and so I'll confine my remarks to how it impacts DCH and my understanding of it. And I did refer to it in my presentation here. I think the biggest impact for DCH is going to be related to the huge expansion of the Medicaid population. And the thing that we need to do, I would implore you to do, is that we, regardless if the courts throw out the health reform law in total, the fact remains that Georgia has an antiquated Medicaid eligibility system. We really need to get that money. We need to update that system. And so to the extent, I guess my comment on that would be, to the extent we can utilize those things that are going to be very advantageous to us, we need to do that, and we need to do that well. In other areas, there may be areas that are not implemented, but I frankly think that's going to be a little bit more in the private sector side, where some of those bigger questions are going to be. Again, in DCH, I think it's going to relate primarily to the eligibility determinations that are required to be made by the exchange as that's implemented, which is really a more private insurance company model. And there has to be a determination as people look at that, whether they're eligible for Medicaid or Peach Care. What we need to do is be ready for that. And number two, even if it's wiped out, we still desperately need a revised, more efficient Medicaid eligibility system.
Representative
I hope
Amerson.
that answers your question. Yes, sir.
Representative Amerson.
Mr. Commissioner, I have
Yes, sir.
two questions.
Yes, sir.
One, the governor said he's permanently removing 14,000 slots, and you conveniently said some open positions. How many of those slots are you going to lose?
267. And as I understand it, those are currently vacant, and the department has not been filling those because of budget concerns.
Thank you. My second question has to do with well baby reduction of about 12 million total. Back between 2001 and 2002, we passed a bill that eliminated the requirement for premarital blood tests. And one of the reasons that was sold was that all new babies were tested. So how is this going to affect the requirement that we test all new babies?
Mr. Chairman, if you don't mind, I'd like to ask one of my staff to respond to that. Do we know?
Quickly.
You give me the answer, right? Okay, thank you.
Thank you, Tom. I appreciate that.
Senator Unterman.
Thank you. Commissioner, welcome aboard, and
Thank you, ma'am.
We look forward to working with you. And I have several questions, and I guess I need to meet with your department individually. But it's just basically a statement that there are those of us in the Senate that feel very frustrated. We're very frustrated about health care in general, and in particular with the public health department. With the cuts in funding, you're shifting the cost to the local government. We understand that. With the rise in tuberculosis and infectious disease, basically public health is in shambles. And the other thing is the trauma. We didn't even address that today. We're very interested in the trauma, and how we're going to fund trauma is still an alive issue. We think the department needs to address it as an issue. And the third thing is, most of us sitting in here, our hospitals are operating in the red now. I know my hospital, Gwinnett Medical Center, is one of the premier hospitals in the state, and it is now operating in the red. And we're all very concerned about what is going to happen to our hospitals in our districts. And, you know, I think that needs to be addressed. So basically what I'm saying is I think that in due diligence and your fiduciary responsibilities, that you need to work closely with our subcommittees in addressing these issues and working together to try to find solutions, because we're all very concerned.
Representative Houston.
Thank you. In response to sort of a follow-up on that, I'm concerned about the cuts that public health has taken.
Right.
And it has been pointed out to me that one of our CMOs owes public health $12 million. Is that true, and how are we going to collect that $12 million?
Let me make just a general comment about public health first. I agree with Senator Underman that we have a lot of work to do in public health. One of the things that the department, frankly, is struggling with is the absorption of that department within DCH. There are significant management, administrative, financial challenges associated with that. And quite frankly, we need to really make a decision on that sooner rather than later and move on. With regard to the issue that you're talking about, that was brought to my attention recently. I've been on board for 10 days now. That was an issue that I was made aware of, and I know we're looking into it. I think it relates to the transfer of the department from the Department of Human Resources to DCH, where invoices, and we're not clear on this, whether they were sent and not paid or not even sent. What I do know is that we have the IG in our office looking into it, Inspector General, and we have, we'll be meeting with the CMOs on the payment of that.
Did the other two CMOs pay this?
My understanding, it was all three, as I understand it. Right. And, you know, I would expect, and my philosophy would be, the state of Georgia will act in good faith in abiding by our contractual obligations, and we expect our vendors to show us the same courtesy.
Thank you.
Senator Hooks.
Thank you, Mr. Chairman.
Yes, sir.
David, you look good up there.
Thank you, sir. I hope that continues.
My question is a general one, and I'm gonna build on a little knowledge here and your knowledge. Some 30 years ago, this state faced a medical crisis in family practice doctors. And we had ranked the rock bottom of the nation, 50 out of 50 states, in supplying doctors back to the communities across the state. Coupled with that, Mercer University stepped forward through Dr. Godsey, then president, and they agreed to set up a program of family practice doctors. That's all they're going to do, was family practice doctors. The bill came over to the House of Representatives. A couple of us in here may remember this, and it had 90 votes. The Speaker was not known for grace, but he cast the 91st vote and pointed his finger at the Chancellor and all the members of the Board of Regents that had bitterly opposed it, and it passed, went into law. Since that time, we have been able to supply through Mercer family practice docs throughout this state, particularly in underserved rural areas. Several years ago, we entered a contractual agreement to build a campus in Savannah, extend the Mercer campus over to Savannah. And we agreed to give them $5 million, I believe, a year. Now, I know if it's not there, it's not there. And to the best of my arithmetic, in both the supplemental and the big budget, we've got about $600,000 we're sending instead of the $5 million. What I'd like for you to do, and this suggestion, so that we can enter into a good obligation that we entered into several years ago, is set up some kind of plan where we live up to our end of the bargain. They have lived up to their end of the bargain, and now I'd like to see us as a state come up with our end of the bargain of what we promised the medical school at Mercer.
Yes, sir. Duly noted. You know, the physician workforce issue is an issue I'm familiar with. I'm deeply concerned about that. Quite frankly, you can have an insurance card, but if you don't have a doctor or other healthcare provider to provide services, you don't have healthcare. We have some serious challenges. Part of those are complicated by federal issues. At Mercer Medical School, I'm not sure this is actual current year, but the year, maybe last year, they have about 100 students or so. Only two or three went for primary care residencies. They all went towards other specialized areas because of the payment rates that primary care physicians face. So it's a very real problem in the state of Georgia and frankly across the country. So we will look into that, and I look forward to working with you on that.
Representative Lucas. Commissioner.
Yes, sir.
Prior to you becoming the commissioner before you and the last administration, between the budget years of 10 and 11, took $685 million out of the health insurance reserve fund to pay down the budget. You say you have $17 million in reserve now. State employees, premiums were raised as well as their co-payments. And I heard you talk about the $80 on basically surcharge on tobacco use. You know, that's walking around the hall with a cigar in your mouth. I got to pay $80 now. But the question I have to you, how far or how much percentage increase will state employees have to look at on their health insurance costs now going in to 12?
In 12, 10%. And I again commend you for raising an important issue. As we go through the appropriations process, we need to try to do what we can to rebuild those reserves. There's not a lot of room there. And I would, again, commend the staff. I got an email yesterday. They look at it on a day-to-day basis.
Representative Henson.
Thank you very much, and congratulations on becoming commissioner and for the excellent presentation. Page 39, dealing with eliminating the optional benefit coverage for adult vision, dental, and podiatry in anticipation of 2014. My concern, of course, is what folks will do in 2012 and 2013. Between now and then, I went back into working on the front desk at a dental practice this summer. We probably got about 10 phone calls a day from folks that had no insurance, that needed a tooth pulled, had a toothache and all. And this is a Medicaid practice. I can't tell you how many we did treat per day, but none of us have been in a situation with having totally untreated dental pain where we couldn't get treated. Our hospitals are not adequately set up to do extractions. A few free clinics that we have are totally and completely filled. And I'd really like to urge us to try to find the money so that we can continue providing services to at least get people out of pain. You know, the podiatry is important, the optical is important, but I will deal strictly with the dental and would like to urge us to find the money to restore it until 2014. Thank you.
Thank you.
Representative Hughley. Is your line on? Oh.
Thank you, Mr. Chairman. Mr. Commissioner, thank you for your presentation. It frankly scares me, the things that you're telling us. One of the things I'm concerned about is the continued reduction in provider payments. One of the concerns I've been getting recently is access concerns. Providers are on the list, but they're not taking new payments. How do you anticipate that this further reduction is going to affect access?
Well, my hope is that it will not impact access. I probably am more familiar with the physician issues than others, but there is clearly a problem with physicians and others accepting new Medicaid patients. That was a problem with the current payment rate. I don't know that 1% is going to make a significant difference in that. The fact of the matter is that a lot of that, in addition, I am concerned about how the federal Medicare payment rates, and I'm not sure how familiar you are with that, but under the health reform law, there was an anticipated 25% cut in payment rates to physicians. I can guarantee you if that goes into effect, and they have 5 times last year and last Congress, they just postponed that 5 times within that year. Congress has not dealt with that issue. And as physicians and others take a look at both Medicare payment rates, they're going to look at Medicaid rates too. So access is a critically important issue. This is one that my hope is that we begin to come out of the recession and we can begin to address that in a real way.
Last question, Representative Sims.
Thank you, Mr. Chairman. Congratulations.
Thank you, ma'am.
I'm a little concerned that the state employees, you said, were having a 10% increase, but over on your chart that showed the non-certified, that was quite a bit more than 10%, was it not?
Yeah, that does not come out of their pocket. I'm told that's state funds. So would you like to address that? Okay.
So I'm to understand theirs is not being increased, but it says
of the non-certified, theirs is not. They will be. Yeah, like everybody else. Yeah, everybody's premiums go up 10%. The county's portion.
Oh, it's to the counties.
To the county, correct.
Back to
162 to 180. Yeah, we're correct.
Okay, thank you.
Which hasn't been addressed for 11 years.
David, appreciate your,
Thank you, sir.
your excellent presentation. We wish you the very best. And ladies and gentlemen, let's try to make this transition as quickly as we can. Dr. Shelp, come on up. Thank you very much, David. Ladies and gentlemen, please make this transition as quick as we can and take your seats. Dr. Shelp, come on up and let's see if we can get going. Piece of gum. Dr. Shelp, if you'll come on up, we'll get started.
today's census data if you want.
I got it. Okay. I got it.
Chris,
we can plug in.
Yep. Chris, you got the flash, right? Yes.
I need paper version.
Rick has your. Rick has it.
Where is Rick? My apologies. Oh, thanks.
You have your copy. That's your copy.
Yep.
Okay.
Set aside that they're looking at from.
Sorry?
The other pieces.
Oh, the. This here?
Yeah.
Let's make sure 11's on top. This is 11. And there's 12.
Finger right there.
What else was I going to keep on the side?
I've got a folder.
I think that was it. Is that it? What is that?
I'll be here. I can grab and hand you stuff as needed.
We're not paying our workers' comp claims.
We're not going to talk about bonds?
Sorry?
We're not going to talk about bonds at all?
No. If they want to, we can.
Okay. How much was it?
Define how you do it.
It's 8.6, but 2.9 of that is IT.
Okay.
Okay, Dr. Shep, you ready?
I am ready.
All right. Ladies and gentlemen, please take your seats. We're all running behind, and we definitely want to get through this morning. So, Dr. Shep, I apologize for the delay. Appreciate you staying, and thank you for what you're doing, and we appreciate your service and your leadership, and look forward to your presentation. The floor is yours. Thank you.
Thank you. I appreciate that, Senator Hill, and in anticipation of the timing, we had prepared what is going to be a very targeted, budget-oriented presentation to allow as much time as possible for questions. So I am going to move fairly expeditiously through this and begin by outlining our priorities. Our priorities are driven by two settlement agreements that we have with the United States Department of Justice. One is a new agreement that was just entered into late this fall that is simply called the Settlement Agreement, that it deals with expanding community services. And it does not override or replace our ongoing agreement known as the CRIPA Agreement, the Civil Rights for Institutionalized Persons Act. And this agreement is primarily about our hospitals, our state psychiatric hospitals. And again, remind us that we still have Olmstead obligations that really cross both agreements and really merge into some other areas altogether. But those establish our priorities. And so when we look at the requested additions to the state budget, we are looking in the current fiscal year 11 for about $13.4 million in new community services that do not include developmental disabilities waivers. This presentation is really going to be divided into two parts, primarily focusing on mental health and then separately on developmental disabilities. And I'll try to remind us of that distinction as we go. In fiscal year FY12, we are looking at a $44.8 million request, and I will go through some of the detail behind these, but just to get the numbers in front of us. Additional developmental disabilities waivers, we are not requesting anything additionally in fiscal year 11. We are adequate to the minimum of our obligations, but we will be needing about $14.5 million in additional waiver funding for fiscal 12. Our FMAP restoration, these are really the very big numbers that in many cases exceed everything else. And we will be looking at a $10.3 million request for fiscal year 11 and a $54 million request for 12. And I will remind us that the FMAP is that federal match that we enjoyed an enhanced rate where the state was receiving $3 for every $1 of state funds. That 25% match on our side will rise to 28% in March and to 31% in June, and that reflects those needs. In community mental health initiatives, our settlement agreement with the Department of Justice really targets 9,000 individuals that have been identified as having severe mental illness. And this number was derived from looking at our history, both in our hospitals, those that have had multiple hospitalizations, as well as those that have moved across different agencies and our county jails, and are reasonably known by most in the community as having severe need. That's not to say that there are only 9,000 people that we serve that have conditions that require service. Our department has served roughly 100,000 different individuals to one extent or another across the year. Our mental health community initiatives really are in community services, crisis services, and in accountability and control. The new community services targeting these 9,000, I also want to add in all candidness that we will not be reaching the target number of 9,000 until FY15. Our immediate FY12 target is roughly a third of this number, about 3,300, and they will be served across a continuum, some with a very high degree of service and others with much less so. But the nature of these services center on the establishment of more assertive community treatment teams, community support teams, intensive case management and case management, and the numbers are there as you can see, 3,050,000, 270,000, but in FY12 those numbers rise, 8 million for ACT teams, about $500,000 in community support teams, $1 million in intensive case management, and about a quarter of that for regular case management. Now, what are these entities? In brief, assertive community treatment teams actually render service. They actually go into the community and meet the individual where they are, whether that's in their apartment, whether it's on a park bench, whether it's in a coffee house, or wherever they are found. And they actually administer treatment. The teams consist of a psychiatrist, some nurses, social workers, other kinds of therapists, as well as peer support counselors. And they have the ability to give medication, to really render service in the community. And these are really core to serving those with severe mental illness who otherwise will eventually default to hospitalization. Community support teams we often refer to as an ACT Light, or a smaller version of the ACT team. They are about a third the size, and their target population is less in terms of numbers, but they are designed for more rural settings where they have to travel greater distances, and there may not be as many individuals that they're trying to take care of, but those individuals are perhaps harder to reach and require more mobility and flexibility. Intensive case management is pretty much a step down from ACT, where the individual has been engaged in other more conventional forms of service through their community service board, through private providers, through other kinds of treatment, and the case manager simply makes sure that they are getting to those places. And if they're having other challenges with housing or food or employment or something else, the case manager is there to help move them within the different service areas as needed. Regular case management does a similar job, but with people who are less ill, less in need, more autonomous, and so they are able to serve more people who are able to do more for themselves. This map, I think, is helpful in visualizing how these services are distributed and where the needs are. The colors to the map are basically a population distribution. So as you see the metropolitan Atlanta area, Fulton County, this is the high population area, high density, and you see a good many dots there with the various kinds of services. As you move into more rural areas, you see fewer dots. What might be misleading that I want to emphasize is that these dots are just the address of the office for these services. The ACT teams, the community service teams, even the case managers will be moving out amongst all the counties surrounding those dots, so that really everywhere is being served. But the actual office address is going to be roughly where those dots are. So if you look down into Region 5 or Region 4, you see some dots. All those surrounding counties will be served by those teams. But clearly the metropolitan areas are in the greatest need. And you may see both ACT teams and community support teams in the same location. That's simply a matter, again, of balancing population. There may be more individuals in need than can be served by a single ACT team, but not enough to justify having two ACT teams. So you can have an assertive community treatment team kind of make up the difference. This map was, I would like to say, was instrumental in convincing the Department of Justice to adopt the department's plan and to yield their own plan and help us arrive at final settlement in that long, drawn-out battle that took up most of last year. Moving on, the new community services also include more things that may not be quickly seen as mental health oriented, particularly housing supports. But housing, to anyone active really in clinical care of people with mental illness, housing is one of the primary drivers of hospitalization. When someone ends up homeless, from that point forward, everything else is a challenge. It would be a challenge for me personally to negotiate life homeless for a week. If any of you wanted to just walk out your door and hang out for a week and see how it goes. So housing is core to being able to be successful in keeping people in the community, reducing the need for hospitalization, and making them successful. So we have outlined here $1.3 million in supports for 11 and in roughly $5 million in 12. Peer supports, Georgia is really the pioneer in peer support counselors, and they have a very critical role in helping individuals, particularly who are challenged with severe mental illness, to trust and engage a system of care that they may not be very comfortable with or may not have had good experiences with in the past. And they're very critical in keeping people in treatment and advancing their own recovery. So this is a very small amount of money that has a very disproportionate large impact. I wanted to make note of that. Discharge transition planning involves both our CRIPA settlement and the community settlement, and we need about $700,000 in 11 and about 2.8 in 12. Supportive employment is also an area that's very important. It also impacts the developmentally disabled to a great extent. And I would just say, for those who are not personally familiar with supportive employment, it is not sheltered workshops. It's not funding that pays a token wage to someone. Supportive employment are real jobs in real business settings with real benefits. The support is in finding employers, bringing them to a point of embracing hiring someone with a severe disability, and then in providing some mentoring, some side-by-side oversight until they're able to function autonomously. So supportive employment is not just, it's not like unemployment or just some sort of funding directly to the individual. It's in the support to get them into a real job. In community services, we talked about the ACT teams, and what we need to talk about is the monitoring, the oversight of these teams. fidelity or actual delivery of the services doesn't just happen by virtue of setting up the team. We have a number of ACT teams functioning today, but a year ago they were not functioning at nearly half of their capacity, what they were supposed to do. There has to be oversight, monitoring, and accountability to make all of this actually deliver service. So the ask figures are $174,000 and $740,000 for the 2 years, respectively. In mobile crisis, the $175,000 in 2011, I will point out, is simply an expansion of our current crisis line capabilities to do more of what they've been doing, and that's matched with about $350,000 annualized in 12. Mobile crisis teams, we have them operating across the north of Georgia and in Augusta and in Fulton County. But we will not be expanding mobile crisis. We're not obligated to expand it under the settlement until subsequent years, and the goal being full coverage of the state by FY15. Crisis stabilization units, we have new units going up in North Georgia even as we speak, but this funding here is to support one additional crisis stabilization unit in FY11 and in FY12 for a total of one new unit. The community hospital beds is an item that will allow us to begin to use private, for-profit or not-for-profit general hospitals to provide acute inpatient psychiatric care to those in immediate crisis. This will accomplish a number of things. It will move us towards more of a partnership with the private healthcare community. It will also reduce, if not eliminate, the need for multiple stops in going to the hospital, going through an emergency room or what have you. It will allow the sheriffs more options, shorter distances. The consumers being cared for will be able to be treated closer to their homes and will expedite their transition into care. So this is a very critical part of moving forward, and the figures are 1.6 and 6.4 million in the 2 years respectively. What we're calling accountability and control, these may sound like heavy-handed terms. They're meant to, because accountability and control has been severely lacking historically. And we have seen great success in the last year through more vigorous accountability. And I would like to just briefly say that our 30-day rehospitalization rate, since I stood here a year ago, has dropped from 16% to below 10% across our system in 1 year. And that is a significant reduction by almost any measure. I'd also like to add that our total hospital utilization has dropped by 200 individuals across the year, which represents a 20% reduction in people going into the hospital. This is a function of increased accountability and control, both in the hospitals, doing a better job, both in the community, doing a better job of picking up and following individuals, and providing them with other alternatives. So we have seen a great deal of success through enhanced accountability and control. And these figures represent what we will need for enhanced regional monitoring, information technology, and training in these areas. The figures are, as you see them on the screen, 1.2 and 1.4 for the quality management, 600,000 for enhanced regional monitoring in FY12, about $500,000 for community information systems in FY11, and just shy of 200,000 in FY12, and about $500,000 in training for 012. This next page summarizes everything we've just gone over. I won't go through it in detail except to point to the bottom line. The totals, $10.6 million request for FY11 and a $32 million request in FY12. Going quickly to developmental disabilities, our community initiatives include mobile crisis and crisis respite. This is to make possible our commitment to the Justice Department, but also to ourselves, to treat people with developmental disabilities in the community and not in hospitals. People who have intellectual disabilities can be managed within community settings, but we need a system of crisis respite and community alternatives to make that happen. Family supports and expanded waiver services. The next slide on developmental disabilities begins looking at the mobile crisis request. This is for 5 crisis respite homes and 10 mobile crisis teams that will be needed to eliminate developmental disabilities admissions to our hospitals. We have some legislative initiatives as well that are going to be needed to help make this possible, because right now our current laws are being interpreted as defaulting everyone to the hospital. The request for this is $2.4 million in 11 and $9.6 million in 12. Our commitment is to make this happen by the end of this fiscal year, by June 30th or July 1st. Additional waivers. Again, we need no additional waivers in 11, but we are requesting 14.5 in 12 for 250 waivers. 150 will be targeted towards continuing to move people into the community from the hospitals, and 100 to target those that are in danger of going into the hospital if they don't receive waiver services. Family supports, targeting about 400 families to help keep children at home, avoiding hospital services or higher services. 374,000 in 11, about 1.5 million in 12, and another 1.6 for the additional family supports. Family supports really involve an array of goods and services that are aimed at providing families and individuals support needed to continue care for members in their home and keep them from requiring higher levels of care. They include things like specialized clothing, diagnostic services, different environmental modifications, hand railings, modifications to beds, and other things like that. They also involve counseling, training, specialized nutrition, and various other kinds of services. That is the core of our request for the current fiscal year 11 and fiscal year 12. Mr. Chairman, I'm prepared to talk in more detail about any area that you'd be inclined, but hopefully this sets the stage.
Well, thank you very much for the very succinct presentation. It may be easier to talk about adding money than it is to talk about cutting. Maybe that's why, I don't know. Are there questions from the committee? I actually don't have any. All right. Representative Chokes. Really good.
Thank you, Mr. Chairman. Commissioner, can you tell me, you said earlier that your goal was to get to 9,000 and that in the next year or two you'll be revving up and working with 3,000, and then your total budget next year will be 45 million. Is that correct?
That sounds close.
And the reason I'm asking this is there any numbers to compare with other states? Because if you do the math, that's $15,000 per patient. And I was just curious if that falls in line with where we need to be.
Well, it's a very good question, and we have looked at other states, and when you look across the country, you see quite a patchwork. And the actual detail at the level of individuals in the community gets very, very fuzzy. It's not very clear even at the high level of hospitals. Just in our own area here in Georgia, we have 7 campuses. It's very misleading. I stopped saying 7 hospitals many months ago because we have 7 campuses on which we operate 18 hospitals. 7 forensic, 6 civil, 5 developmental disabilities, and 1 very large nursing home. Those are very different lines of service, very different demands, very different funding realities around them. And it's very misleading to compare Georgia's 7 hospitals with North Carolina's 4 hospitals. North Carolina has 4 hospitals, we have 7. It's apples and marbles because their hospitals are all psychiatric. Their forensics are concentrated in Raleigh. That's just one comparison I happen to know off the top of my head, but as you look around the country, you may see things that look the same until you look under the hood, and then you find out that it's a completely different reality. So comparative data is very difficult. Also, it's very difficult to aggregate this kind of data because mental illness is a spectrum condition. Some people with very severe diagnoses still operate virtually autonomously and move about in the community and even maintain jobs and do all kinds of things, whereas someone with the very same diagnosis can be virtually completely incapacitated and need complete care, and everything in between. So I mentioned in the beginning that we serve as an agency roughly 100,000 individuals. This 9,000 number became a negotiating point with the Department of Justice, partly because of the question you ask. The lack of a formula or metric that you can simply impose and say, this is the number, and actually even an absence of numbers that you can honestly compare to. So what we focused on were the most needy, the most vulnerable, and we agreed to identify them from our own resources, what we knew from our hospital history and from our partners in our community service boards and private providers and other hospitals, emergency rooms, and some information from the sheriffs and corrections to come up with a number around which we agreed we would negotiate. This number, I will emphasize, is the bottom. It's the lowest number that I can say with a straight face. There are many more than 9,000 people in Georgia with schizophrenia. Epidemiology alone would tell you that there's something like 70,000. But many of them, it's not as though Georgia is doing nothing and we need this money to do what we need to do. We're doing a great deal. This is what we need to bring ourselves to a point where we can say we are responsibly meeting the needs of the most vulnerable in compliance with the American for Disabilities Act and the Civil Rights for Institutionalized Persons Act. That's more of an answer than you probably wanted. I'm afraid I could talk about this all afternoon. Does that satisfy the question?
Representative Murphy.
Thank you, Mr. Chairman. Mr. Commissioner, here I am.
Oh. There you go.
I want to just follow up on the question that Representative Choke has presented to you as it relates to different campuses throughout the state. Mm-hmm. As you know, the community that we serve, Gracewood, has a campus with a variety of different services. As a response to the settlement, what portion of those services that are being provided on the campus at Gracewood will be transitioned into the community? All of it is under the settlement agreement, or just exactly what direction are you going?
All right. Excellent question, and let me put this in some context. If you just look at the settlement agreement, it does look like we're going to simply move everyone out over the next 4 years. There are 2 provisos in that settlement agreement that are very clear that modify that. There has to be consent. There's a preservation of choice within the settlement agreement. So the preservation of choice was something we insisted upon. The second is the medical ability for someone to be served in the community, and that is left to the discretion of the attending physicians, the medical clinicians that will make that kind of determination. So at face value, I would have to say no, it won't be everyone. And so that's a general context that applies to all the effort in developmental disabilities. Choice and the medical ability for the person to be safely housed in the community. Having said that, Gracewood in particular should be seen in a larger context. We established early on in our new department a partnership with the Medical College of Georgia, soon to become the Health Sciences University of Georgia. And I've now met, though very briefly, with Dr. Aziz on 3 occasions, and we will be meeting again more substantively about the increasing partnership between the Augusta campus, which includes Gracewood, with the Medical College of Georgia and where they're going. To be flat out direct, our goal is that we will merge that entire state campus into the university system over the next few years to take advantage of the medical expertise and the ongoing science and support the University Health Sciences University and provide the best care for those folks. So that when way down the road in the ideal world, that campus will continue to serve both people with developmental disabilities and mental illness, and I hope some forensic services as well, because forensic studies is part of the university's goal as well. So just to echo something that Commissioner Cook said, workforce development is also in our planning in all of this, and looking to merge our needs with the activities of other partners who are part of building up the workforce and delivering the same kind of service with the most current medical and psychiatric knowledge.
Thank you, Mr. Commissioner. Thank you, Mr. Chairman.
Yes, sir. Representative Neal.
Thank you, Mr. Chairman. Commissioner Shell.
Yeah.
I think it was on slide 8 you talked about housing, supported housing, and I agree with you when you say that housing is core with what we're trying to do. Are we talking about 9,000 severe and persistent mental illness clients who will be receiving supportive housing by 2015?
Not exactly. We're talking about 9,000 individuals with severe mental illness who will be living somewhere. Now, that does not mean that they will all be directly supported. They fall into a couple of groups. Some have housing, and they go in and out of it, and they have other needs, but housing is not necessarily one of those needs. That represents a small portion. Another portion are those who will have housing that will be coordinated through other housing opportunities, through HUD housing, through Department of Community Affairs, through some of the metropolitan housing authorities, or maybe metropolitan is not the right word, but the other housing authorities. And the numbers that I'm asking for in this budget are to cover those who fall out of all those other possibilities. Because people with severe mental illness have often committed a crime, a felony, or they fall into some other area that excludes them from federal HUD housing. And yet they still have this housing need. Not all felonies are as heinous as the word first sounds. And so I'm not trying to say that we're sympathetic to felons or whatever, but people with severe mental illness who have not received proper services, if they are neglected and allowed to simply move about, bad things happen eventually, as we've seen recently in our own country.
We're talking about the most vulnerable when we're talking about these 9,000.
Correct.
It would be my belief, and maybe I'm wrong on this, but it'd be my belief that when you're talking about that most vulnerable, that the majority of those will have those type of housing issues.
Well, they will, but how the issues get met will be met in different ways. And when we looked at these 9,000 actually were pretty specifically identified. And when we looked at this, we matched this up against what DCA could do through HUD and through other things. And we're looking at what we feel is a minimum to support those who fall out of everything else. We're coordinating through the Coordinating Council, which recently added DCA to the council, and Commissioner Beatty showed up at his first meeting with tremendous enthusiasm. So we are going to be accessing all other available funds, and this, in our request, is for those that will fall out.
Okay.
But you're correct. All of these folks will be in need that we'll have to address.
Are you comfortable with the number that we're starting with in 11 and 12? Is that a comfortable place for us to start in order to be able to reach our goals by 2015?
It is a number below which I would be terrified.
I think I know what that means. And you are working closely with DCA to provide other housing alternatives in addition to what we're going to be doing through the department.
We are. I'm very excited. There's a feeling of excitement across many agencies. Commissioner Cook, Commissioner Reese, and I have had lunch and met and had discussions about what our agencies can do together. We've talking with DCA and the other members of the coordinating council. We're all very excited about what we can do together.
Thank you very much.
Senator Grant.
Thank you, Mr. Chairman. Mr. Commissioner, I come to you today with the same concern that I came with you a year ago. And last year at this time, you announced that you were closing the adult mental health services at Central State Hospital. Most recently in the news, you've announced that we'll be closing the Northwest Georgia Regional Hospital in Rome. A year later, we still have problems with community services in the Middle Georgia area, and the resources that Central State Hospital made available have not been replaced. And I just wondered, what do we have plans for Rome, and how will that community be different? Hopefully we won't have the same problems in in Northwest Georgia that we've had in Middle Georgia, but I still contend that we cannot close our hospitals, which are a safety net for these most vulnerable citizens, without having these community services in place.
We know there are some differences between the two examples. The situation a year ago around Central State was at the very zenith of the Department of Justice's investigations and concerns that they had. There were some serious quality issues that drove those decisions that were far from ideal. And we have, going forward, some initiatives. We'll be talking with the community service boards in those areas, particularly Oconee and Serenity. I know our Director of Mental Health Services has an appointment to be meeting with them. We've been in closer communications with Shannon Harvey at River's Edge and Oconee. We have set up a crisis center at the Oconee Hospital. We have also enhanced the capacity at Augusta. But I'm not going to try to tell you that everything is what it needs to be in Central Georgia yet. We are also still in conversations with Mercer University, both at their campus in Macon and in Savannah. Unfortunately, the negotiations with the Department of Justice consumed almost all of 2010, and the ambiguities and uncertainties about those really serve to delay many activities within the department. That being said, the hospital at Northwest is of a different sort because there is not an acute clinical problem at the hospital. The hospital actually did very well in its last review by the Department of Justice. But the region as a whole, Region 1, if we go back to that map, you can see a black line that runs across from, well, I'll just trust that you can see it. The Rome Hospital is in Floyd, and historically it has served all the way across to the South Carolina border, from Alabama to South Carolina. The planning currently calls for the utilization of general hospitals in Cobb County and in Hall County, which will allow individuals being served to receive hospital services much closer to their community, wherever they're coming from. We are also in conversations with the hospital in Floyd and one other hospital, Dalton, to share in those kinds of services, and that's where some of those 35 hospital beds are going to go. In addition, crisis stabilization units will be going up similarly in those geographies, along with the new ACT team in Floyd and a number of other things. And we've tried to recently make clear to the community that we have dates as targets, but we're not under any compulsion to close the Rome Hospital prior to having all of these other services up and running and ready to receive individuals.
Mr. Chairman, could I have a follow-up? That's an admirable goal to use those community hospitals, and I think that's probably long-term a good plan. But most of these hospitals have are in crisis in a great deal themselves, and it would seem to me that they would not be willing to take on an additional indigent population service without having a significant subsidy from the state. Are we prepared to be able to do that to those hospitals?
Yes, that's what's in the budget. And when we first met with them, we're somewhat surprised at their enthusiasm because they are in challenged positions, as you said. And so this does represent a revenue source for them, and this is not simply defaulting indigent services to those hospitals. This is in the budget for the 35 beds. That figure comes from multiplying 35 by 365, and they will have that funding.
Commissioner, it looks like you've answered the questions. Oh, okay. What number is that? 87. Representative Houston.
Thank you. Now, I understand you said that we have 7 mental health hospitals in the state.
7 campuses.
7 campuses. Okay. Was the approval rate from the Justice Department good on all 7 campuses?
We did not receive an official assessment from the Justice Department. My determination that it was good was simply my own subjective assessment from people on the ground, and the fact that the Justice Department initiated coming back to the table after having reviewed the hospitals.
But I thought you said something about the Justice Department approved the way the hospital in Rome was run. What was that saying?
What I hope I said was that the hospital performed well during that survey.
Okay. Did all 7 hospitals perform well?
Only 5 were visited, and as I tracked this really hour by hour, everything went well on all 5 campuses. Okay.
I still can't understand why, if Rome was performing well, how that one was picked, because I don't understand if you're going to save $5 million by closing Rome, but how much money are you going to have to put in the hospitals to take care of these people in private hospitals? Are you going to spend $5 million?
No, the $5 million, that's a budget number that, in my mind, I think is better thought of as we will have about $17 million saved by moving out of that facility. Of that, we are redirecting $12 million into community to pay for the beds that Senator Grant just spoke to, and to raise up the crisis stabilization units, the ACT teams, and we will reinvest that much. A little over $5 million we're in a position to to yield back to the state in a budgetary way.
Well, it concerns me that, as Senator Grant pointed out, you've had a year to get the mental health services in his area worked out, yet we're going to do this in 6 months in Rome, and we couldn't have it done in a year in Millersville. I don't understand how you're going to do it in 6 months.
Well, we're not starting from zero. The procurement.
Were you starting from zero? I mean, do you understand where I'm coming from?
I do. We were really starting from inside our own end zone a year ago. We're really starting from more like midfield right now. The procurement for the procurement for the ACT teams has already been done. We had 23 respondents for about 12 ACT teams. The final determination hasn't been made. That's with the agency that does that, and we haven't. The final awards haven't been made, but the entire procurement process is completed, and so we anticipate awards very shortly. So the ACT teams will be up and running within the next month or two. Similarly, for the crisis stabilization units, those have been awarded, and the site determinations have been made for some. One may possibly be changed, but those are well in motion. And in Middle Georgia, it's not as though nothing has happened. We have expanded the services at the crisis stabilization unit at River's Edge, and we have expanded the capacity at Augusta. We've opened up new units there, and we've set up a crisis program in Oconee. So it's not as though nothing has happened. I'm not trying to say that anywhere is perfect, but we are certainly further along. In Rome and Region 1, the geography supports the choice as much as the finances and everything else. And the location of some very strong providers, the Cobb Douglas Community Mental Health Center, Community Service Board, Highlands, Avita, and Lookout Mountain, are in a better position to take on some of these responsibilities. So we're much further along, and we are not compelled to do anything prior to having those services satisfactorily in place. In Middle Georgia a year ago, we were much more under the gun with the Department of Justice. They had, in fact, done a survey at Central State where they did deliver a very scathing report, and we were in a completely different posture.
So we really aren't compelled to close the hospital in Rome by July 1?
I think it's important that we have dates. If you don't put a date out there that you work to, then things don't progress. But we are not hidebound to dates. So our commitment is very clear, and we will not close Rome prior to having the other services in place. But we do feel that it's important to have dates so that we work to that. If I was to put a date out there for next January, I'm not certain very much would happen between now and June.
All right.
Thank you.
Commissioner, thank you very much for coming and giving this presentation. We certainly look forward to working with you over the next year. Thank you very much.
Thank you, Senator.
Commissioner Mark Butler, Great American. How you doing, buddy? Good to see you, sir.
Oh, thank you.
Oh, you got it.
Commissioner, how are you? Good to see you. Hey, fine. How you getting along? Good to see you. Good to have you on. Yes, sir.
Yeah, she's taking it. She knows what to do with it. She's done this every time. She's giving them the money.
You could probably go and sit down.
Can we just stay over here?
Mm-hmm. Matter of fact, if Russell wants to, or somebody, or I tell you what, get Brock to come down right No, I mean, I'm sitting in a seat right here somewhere close by.
I'm actually following her. Okay, Commissioner Butler, you got the true faithful out here now who are left, the last speaker of the day. And
right before
you
lunch.
can tell these are the ones that are plugged in. They're also the ones who knew you were going to win the whole time. We're glad to have you. Glad to see you.
It's good to be here. I will have to confess, Chairman, it is a little weird. You know, I'm used to being sitting out there where y'all are, so this is very strange. So, but we're adjusting quite rapidly.
There you go.
Well, it's good to be here, even if it is on the opposite side of where I used to be, and it's good to see a lot of the smiling faces out there. And I will try to be brief. I know we're over right now, and I know we have a lot of hungry people, and as a former legislator, I know that it's not a good thing to get in between y'all and lunch. So what we want to do, y'all have handouts I believe that everybody has gotten. So what I want to do is I basically just want to hit the high points, and I'm going to combine my comments for 11 and 12 for each one of these at the same time, so we don't go through this twice to try to save time. And at the end, we're going to wrap it up, and we're going to talk a little bit about the Unemployment Trust Fund. Starting off, if you'll see up here on the screen, I want to talk to you about safety inspections. Right now, according to the governor's recommendation, we're going to be reducing that by $167,000. That effectively eliminates 6 safety inspector positions. Now, what I want to emphasize here is this is a part of the Department of Labor that actually produces revenue. This is not a drain on state resources. We actually produce more revenue than what we are appropriated to spend. So when we ask you for more money, we're not asking you to take away from somebody else. We're asking to get back some of the revenue which we are producing. Now, the effect of this cut, this $167,000, actually on the back end at the end of the year will actually cause a loss of approximately $516,000 in state revenues. So whereas we're cutting $167,000, the net effect of this is our actual revenue losses are going to be much greater than that by doing that. So I'd ask you to take a look at this, reconsider this cut, just because of the fact you're not actually getting a savings. You're going to be getting a loss in revenue on the end of this. And that's for the amended budget. Okay. Now, Chairman, would you like me to take questions at the very end, or
just keep going,
okay,
and we'll take them at the end.
All right. Next, I'd like to talk to you about Warm Springs. Warm Springs actually in 11 takes a $677,000 cut, and then in 12 takes a $731,000 cut. One thing to keep in mind, we will be losing some federal match on this. Roughly a little bit over $300,000 will be in addition to this cut. This will eliminate 54 hourly positions in 11. It will eliminate 27 hourly positions in 12. 80% of these positions are direct care positions, people who are actually touching patients, touching lives, working with individuals. Also, in this cut, I'm sure a lot of people are familiar with Blaze Sports, that contract. This also included, there's an 8% cut to that contract for both years. All right, now moving right along. Vocational rehab. Now, if you're looking at my tracking document that I gave you, I know this doesn't quite go along with the slides. We noticed that after the fact, so this is going to be line number 2. In the governor's document for 11 and 12, we're looking at a little bit over $1.4 million in cuts to the vocational rehab program. However, I would caution, or want to make you aware of the fact, this cut actually does affect matching dollars to a tremendous amount. This would cause us to lose $5.1 million in federal matching dollars. Also, there's a maintenance of effort penalty due to the reduction in state funds, which will be another additional $1.1 million. As you see through your tracking sheet that I gave you, this does affect many positions. And the thing is, I mean, we're definitely not overstaffed in this area. One thing we have found out is your typical vocational rehab counselor actually has, each one of them has 160 to 200 clients that they deal with just by themselves. So, they're doing the best that they can. We would hope you would take a look at this, because the federal funds are very important that we try to keep as many of those as we can, because that is how we pay for a lot of our services and direct services. Go ahead and click the next slide. Okay, unemployment insurance. I know we've heard a lot about this. Talk about this, about the trust fund. Right now we're going to talk about the program first of all, and then we will move on to the actual trust fund. In 12, what we have is a cut, or actually not really a cut, but we have been asked to pay for the first interest payment on the money we've had to borrow. We've been asked to take that out of our administrative fund to pay that first payment, which is roughly about $6 million. Now, that pretty much eliminates most of the administrative assessment funding from this particular program. This does affect our workers. Now, the workers that it affects the most and the position that will have to be eliminated are basically the people that work in your local Department of Labor offices. We have an example just in your tracking sheet. These are actual employees. And the problem with that is these are the people that are actually trying to help get people back to work. When we get people back to work, we have less claims. And when we have less claims, we have more people paying into our insurance fund. So really this is a situation that we have to be very careful with how we use this money. The administrative assessment money was intended to be used for basically helping us pay for our programs, pay for our employees, to help put people back to work, and also to fund programs. We would like you to take a look at this. We do have some solutions to this. The Administrative Assessment Fund does come up for renewal this year. It is a federally certified program which we have been participating in, so it's not to use state general funds to pay for these programs in the past to help people get back to work, and they are very effective. We are one of the top states of getting people back to work faster than everybody else, and it's because of these types of programs that we're able to do that with. And so when we bring the Administrative Assessment program back to you to be reauthorized, I hope you will do so. Otherwise, we're going to have to come up with a lot of money to replace this out of state general funds, and I'm sure we don't want to do that. And that's a brief explanation of where we're at right there. Now let's talk about the Unemployment Trust Fund. We're going to give you a very brief explanation. I know that this is a great concern to everyone in here because we're very worried about paying this back because it affects everybody here. Okay, first chart you'll see, this is, I want to give you a little background here quick. This is tax revenue that we have gotten for the Unemployment Trust Fund. As you can see, as it tracks along, if you'll take a look, right around 1999, you'll see a dip and then basically a flat line for a while. Now what that is I don't know, some of y'all were here back then, but what is a tax holiday was instituted to help the businesses, kind of a, I don't know if you want to call it a thank you, or basically, you know, you can call it a lot of different things. They basically gave a little tax holiday back then. And that's where you're seeing the flat line. Now, you'll see the large jump in 2003. That's not because of a tax hike. That was the end, the statutory end of that tax holiday, and so that's why you see the jump. Now, let's go to the next slide. Now, here's the interesting part. The red line are the benefits we've had to pay out. Now, you'll see that during the tax holiday, when we basically were taking in much lower taxes because of the holiday, our benefits, because of 9/11, the recession that followed that, shot up. So you've got a line where benefits are being paid out is going this way. Our revenues have flatlined because of the tax holiday. Now, we kind of had a little bit of a break there when the economy improved shortly. However, our fund did not have time to recover from the tax holiday and the loss of revenue before the current recession we're in, which started in 2007. That's why you see the red line, and there's a good reason why it's red, spike, and you see the payout of over $1 billion, while the revenues have only been, you know, almost roughly half of that. Now, hindsight, they always say, is always 20/20. If we went back and we looked at that tax holiday that was instituted back then, had we have not had the tax holiday, we would actually be one of the very few states right now that would be in the black. We would not have to borrow money. Matter of fact, we would have money that would be left over. Go ahead and go to the next slide. Because as you see, right here is our trust fund balance in the black line. You see that one? All right, if you go and look, 1999, you see where it's crested? We had a very large, we had one of the strongest trust funds in America here in Georgia. As you see, we had a very, big bounce, but coincided with what I've talked about earlier, you see where we gave the tax holiday, the payouts increased, and that black line went from way up here to way down. Now you see as it started to get back on its road to recovery, but when 2007 hit, and our payouts increased, as you see, it dropped sharply again. I mean, nobody saw this coming, and this is the first time in the history of this fund in Georgia we've had to borrow money. So we can definitely paint it back to the tax holiday. So I caution y'all in the future to really think those out before you do them, because even though we thought we had a lot of money, apparently when things like this happen, I don't think you can have enough money in your piggy bank to cover these rainy days, because I don't think anybody foresaw us having this many years at this sustained rate that we're having to deal with right now. So I guess your next question is, what are we going to do? Well, I can tell you that we're currently looking at programs right now. We're looking at being very aggressive on trying to get this money paid back. However, we are going to have an interest payment that is due near the end of the year. It's estimated approximately to be about $6 million. We will have to borrow. However, we do have a plan. Go and click the next one. At our current 2012 tax rates that are currently codified right now that are in the code, at our current rates, if you'll look, you'll see that as the tax revenue will start to increase, and hopefully, and now I'll go ahead and tell you that these estimates are extremely conservative. I had them to revise these twice. We looked and we talked to everybody out there, all the economists, the Georgia State, Georgia. We looked at all of their projections about employment or unemployment decreasing, and we made ours even more conservative than theirs. So this is a very conservative estimate. We're hoping by near the end of 2012, our revenues will exceed what we're paying out. So, I mean, you're looking at at the end of 2012 before we get to the point where our revenues are actually going to be close to being equal to what we're paying out of the fund. You know, that's not including paying back the principal, which we have to do because now there are penalties that are associated with us owing the money. Now, the interest is already there. We have to pay the interest. However, the longer we go without paying back the principal, the feds will start assessing a higher rate on their FUTA. And then they will start adding that money back to what we owe. Which will help pay that back. However, that will also be an additional burden on our businesses. And to make you feel even more warm and fuzzy about this, the FUTA taxes that our employers here in Georgia send to Washington right now, we are currently only getting back about 38%. So over, around a big chunk of a majority of our money that we send to the feds on the FUTA tax goes to other states, not back to us. So that should really make you feel warm and fuzzy about us having to pay interest on this money. But going forward, we would like to work with the General Assembly and the governor, not this session, but next session, about taking a look at our current unemployment tax structure. It's very antiquated, it's old. We need to take a look and see a different way we're already looking at different states right now that have updated theirs. We want to work with y'all and come up with a better system, maybe over the interim. I know that we don't do study committees right now. However, anything we can do to help do that, or maybe work with one of our standing committees to have some meetings. We really need to take a look at how we do our unemployment trust fund and how we do our tax code for unemployment. And I'd be happy to take questions. I know there's going to be some.
Representative Chokas.
Thank you, Mr. Chairman. Congratulations, Commissioner.
Thank you.
On your slides and your projections, can you tell me how extending the length of time of benefits affected the drain that we have on our
Yes, I understand what you're asking. You're asking about the extensions that you read about. Those actually, this is a point that gets confused a lot. Matter of fact, I'll go ahead and tell you that I was confused about it about a year or so ago too. I didn't understand exactly how the extensions played into it. Our trust fund pays out on initial claims. The extensions, that's on the federal side. So yeah, that's but our initial claims are up. So we're still being hit very hard in our in what I say our trust fund. It's I feel kind of funny saying our trust fund since we don't really have any money in it. It's just more money that we're having to borrow. So.
Representative House.
Explain to me how you can borrow money. I was under the understanding that Georgia had to operate on a balanced budget. Is the trust fund different that you can borrow money?
Yes, the trust fund is separate from the general fund. It's a separate program.
So
but yes.
Who do you obligate with when you borrow money from the trust fund?
The employers of the state of Georgia.
Thank you.
Other questions? Well, you must have covered it.
And we try.
All right, Commissioner, we thank you very much for coming.
Thank you.
I wish you the best. Ladies and gentlemen, we'll be back at 1:30 for the federal block grant hearings if you've never attended.
Okay, we'll get started. I'd like to welcome you all to the afternoon hearings. This is a legislative public hearing on block grants. and this meeting is hereby called to order. I appreciate your participation. And Representative, you want to come up front? Y'all want to come up front? Hello, Mr. Chairman. Okay, all righty. Okay. Okay, all righty. I'd like to welcome you this afternoon, and I am Senator Renee Enterman. I represent the 45th Senate District in Gwinnett County. Sitting on the podium with me is Chase Jones, representing the House Budget Office, David Bain, representing the Senate Budget and Evaluation Office, Marshall Norwood, Budget Director for the Department of Human Services, and Lee Wright, Director of Budget and Finance for the Department of Behavioral Health and Developmental Disabilities. And of course, we have the chairman with us and Representative Houston, and I also have my Senate aide, Marcy Draper, with me on the right. Before we get started, is there anyone who requires sign language interpreter services? If there is, if you'll just raise your hand or stand up. There appears to be no one, and we appreciate you coming today and helping us out. Thank you for attending today's block grant hearing. The purpose of the hearing is to receive public comments on the use of 5 human services block grants that Georgia receives from the federal government. The hearing also provides the members of the Georgia legislature the opportunity to listen to the views of private citizens and other interested parties on how block grant funds should be used for state fiscal year 2012, which will begin July 1st, 2011. These block grants are Community Mental Health Block Grant, Community Services Block Grant, Low Income Home Energy Assistance Block Grant, Social Services Block Grant, and Substance Abuse Prevention and Treatment Block Grant. Public input is an important aspect of the deliberative process that the Georgia legislature undertakes in making decisions about the state budget. Thank you for taking the time to participate in this process. At this time, Marshall Norwood will provide a brief summary of the grants and explain how we proceed.
Thank you, Senator Unterman. As Senator Unterman has told you, the Department of Human Services will receive public comments on 3 federal block grants today. By federal law, Georgia is required to hold public hearings on these grants. These 3 grants are the Community Services Block Grant, Low Income Home Energy Assistance Block Grant, and the Social Services Block Grant. At this time, I'll give you a brief overview of each of these grants. The Community Services Block Grant provides funds for services and activities that impact the causes of poverty and assist low-income participants. These funds are distributed to local agencies throughout the state and fund a wide range of services, including employment, education, meals and nutrition services, and housing services. The Low-Income Home Energy Assistance Block Grant provides cash assistance to qualified low-income households for home energy costs, weatherization costs such as insulation, caulking, and weather stripping, to reduce energy consumption and for energy crisis intervention. And finally, the Social Services Block Grant funds various services such as daycare services for children, adults and persons with mental retardation, home-delivered meals, homemaker services, transportation, and protective services for adults and children. This grant also assists families to achieve and/or maintain economic self-support and self-sufficiency. At this time, Lee Wright, the Department of Behavioral Health and Developmental Disabilities Director of Budget and Finance, will provide a list and brief summary of his agency's grants.
Thank you, Marshall. The Department of Behavioral Health and Developmental Disabilities will receive public comments on 2 federal block grants today. These two grants are the Community Mental Health Services Block Grant and the Substance Abuse and Prevention Treatment Block Grant. Here's a brief overview of each of these grants. The Community Mental Health Services Block Grant implements the provisions of the Mental Health State Plan by providing services to individuals with a serious mental illness and to children with a serious emotional disturbance. The Substance Abuse Prevention and Treatment Block Grant provides funds for community-based alcohol and drug treatment, prevention, and early intervention programs. Now we'll turn it back to Marshall to continue the proceeding.
Thank you. More details about each of these grants, including types of programs that can be funded and their proposed funding levels, are included in the color-coded pamphlets that are available on the table just outside. There's a separate pamphlet on each grant. Before receiving your comments, let me go over a few ground rules. We will take speakers in the order in which they signed up to speak. If you have not signed up yet, you may do so at the table outside. Please give us your name and the name of the organization you represent. If there's more than one representative here from the same organization, please choose from your organization one person to speak. By doing this, we will ensure that each organization and citizen gets a fair chance to comment. You will be given 5 minutes in which to present your comments. There's a timekeeper who will let you know when you have 1 minute left. I will initially call 2 speakers to the podium at a time. As the first person is speaking, the next speaker should be making his or her way to the podium. Then as I call your name, please make your way to the podium. If you have written comments for the record or a copy of your speech, please place these on the table outside at the end of the meeting. We'll begin now. We have 2 from the Georgia Council on Aging. And again, if we would have one to choose to speak, we have Ann Williams and Vicki Johnson.
Marshall, I'm the director. If you don't mind, they're speaking about 2 different issues. We would like for them both to be able to speak if you don't mind.
It's okay with the chair? Sure. Let's proceed. Ms. Ann Williams and Vicki Johnson.
I'm Ann Williams with the Georgia Council on Aging, and we really appreciate the opportunity to be able to testify here today. As you know, the Council, in its advisory capacity to the state government, we wish to address the allocation of social services block grant, this SSBG funding for seniors. In the past, SSBG monies have been allocated to the local communities through contracts with the Department of Human Services Division of Aging Services to provide programs and services to enable older Georgians to continue living at home in their communities, often delaying or preventing nursing home placement. In addition, SSBG monies help to ensure that Georgia's most vulnerable adults are protected through Adult Protective Services and the Long-Term Care Ombudsman Program, which works to improve the lives of residents of long-term care facilities. Now, support for aging seniors through SSBG includes such services as home-delivered meals, homemaker services, adult daycare, respite, and transportation. Aging clients who have difficulty completing household chores and personal care tasks but do not need a trained specialist are served with SSBG dollars when they're spent for homemaker services such as washing clothes, preparing light meals, bathing and grooming, and shopping for groceries and prescriptions. Services like these help keep an elderly person at home, improving their quality of life and alleviating the burden on the nursing home system. The Aging Network of programs and services also assists those who voluntarily care for elderly family and friends. SSBG dollars fund programs that are a resource and a tool for caregivers, encouraging them in their efforts. Due to the large population of older Georgians and the influx of aging baby boomers to the state, the maintenance of these services is a critical concern. The cost of caring for an older citizen in a nursing home is approximately 3 times the cost of providing these types of supportive services in the home. By aiding Georgia's aging population with these services, taxpayers benefit from the efficient use of care dollars on less costly forms of assistance. And we recommend continuing the allocation of SSBG dollars to the Division of Aging Services for these programs for older Georgians, and ask that you do not cut, but consider maintaining the current allocations. And thank you.
Thank you, Ms. Williams, for coming.
Good afternoon. My name is Vicki Johnson, and I am an appointed member of the Georgia Council on Aging. I thank you for the opportunity to testify concerning the importance of social services block grant funding for senior services in Georgia. One of the social services block grant's primary purposes is to prevent or reduce inappropriate institutional care by instead providing community-based or home-based care, which assists individuals to achieve or maintain self-sufficient lives. As a result of the revenue shortfall and current economic condition of the state, many critical services have been reduced or eliminated entirely. SSBG support is critical to aging services. In particular, I wish to address the recommendation in the governor's budget that $99,032 in general state funds be replaced by SSBG funding in fiscal year 2012 for providing transportation services throughout the state. This item is on page 217 of that document under Departmental Administration. It is critical that this level of funding be maintained for transportation services, as this service gives senior adults access to their communities, medical services, nutrition services, adult daycare, and a host of supports which keep them healthy, involved, and living at home. Seniors benefit, and Georgia saves by not spending skyrocketing Medicaid costs for institutional care. Just as importantly, these SSBG funds need to be new funds for the Division of Aging Services and must not simply be redirected funding within the division. If new SSBG dollars are not allocated, services such as home-delivered meals, adult daycare, congregate meals, and in-home supports will be reduced to cover this allocation of SSBG funding for transportation. As you know, the population of older Georgians is growing and will continue to grow more quickly than any other group into the middle of the century. Access to services is critical so that older adults can maintain as much independence as possible. To that end, transportation services are critical. The Council encourages you to maintain this level of transportation funding, but to do so by increasing the SSBG allocation for aging services. Please do not reduce other critical aging services in order to fund transportation. I encourage you to provide the necessary funding for the Division of Aging Services so that older Georgians will continue to receive these vital and necessary services. Thank you for your consideration.
All right. Thank you, Ms. Johnson.
As we look through the list, no other attendees indicated that they wish to speak. However, there was one we could not determine from the handwriting, so I'll ask if Anna McLaughlin from GBN. No. Very good. Is there anyone else who would like to speak? If so, please approach the podium and give us your name and the organization you represent. If not, I'd like to thank each of you for attending today's hearings. Would any member of the panel like to speak?
No. Is there anyone like to say anything? I think we've been in budget hearings for so long. The last couple of days, we're numb. Thank you. We appreciate the chairman taking the time to be able to come, and we appreciate your assisting with us in DHS. With that, I suppose that we'll call the meeting to a close of the public hearing on block grants. Thank you very much for coming.
Thank you.